Good evening, everyone. Welcome to the inaugural session of Ayur Samiksha 2021, an international virtual convention on Ayurveda and research advances in COVID-19 organized by Ayurveda College Coimbatore in association with Diksha e-learning. Co-sponsored by Jignasa Tamil Nadu, Remedy Ayurveda Center Qatar, Healing Earth, Ayurveda Sangamam Tamil Nadu, Din Acharya USA, Escola de Sebres Ancestrais Brazil, I Ask Ayush, and Ayurveda Library. Quoting Sri Buddha, drop by drop is the water pot filled. Likewise, when the wise man gathering it little by little fills himself with good. It is my great honor to welcome you all to this platform where great scholars, teachers, and physicians come to unify and propagate the holistic science of Ayurveda worldwide. Now, without any further delay, let us start today's session.
First, to mark an auspicious beginning of today's inaugural session, let us invoke the blessings of God by prayer. For prayer, I would like to invite Vinata. Over to you, Vinata.
नमामि धन्वन्तरीम् आदिदेवं सुरासुरैर्वन्दिता पादपद्मम् लोके ज्वरारुक्भया मृत्युनाशम् दातारमीशम् विविधौषधीनां क्षीराब्देरुतितं देवं पीतवर्णं चतुर्भुजम् नमामि धन्वन्तरिं नित्यं नानागदा निशोधनं नानागदा Nishodhanam.
Thank you, Vinata. Now, to deliver the welcome address, I would like to invite Dr. Chandra Mallishwaran P., Principal, Ayurveda College, Coimbatore. Over to you, sir.
Very good evening, one and all. It is my privilege and pleasure, in inviting you all for this beautiful evening, for this gathering, and for this seminar. Okay, and my humble pranam to everyone, my dears, maybe students, practitioners, teachers, gurus. So my humble pranams to everyone. And I would like to start my welcome address just saying this beautiful quotation. This Rajastamobhyam Nirmuktas Tapo Jnana Balena Cha Yesham Trikalamamalam Jnanam Avyahatam Sata. So this is about the Apta. So yeah, Apta can be anyone. So it can be, even we can learn from a child. That's what I believe. And there is no stoppage for learning. Learning is a continuous process. Okay, there is no end for learning because knowledge is infinity. So you gain the knowledge, by studying the scriptures or through Tadvidya Sambhasha or through Aptas. Okay, so today we are inaugurating a beautiful international convention on COVID-19, and we see many of the, all of the speakers, rather I would say, are Aptas, and I know there are so many participants. I can say they are also Aptas because, as I said, we can learn from each, and even we can learn from the nature. We can learn from every creature. That's what I believe. Just see this simple virus. I rather say it's not a simple virus. Of course, we say it's, we don't see it. You can see it creates havoc. So we learned so many things after this COVID came. We learned so many things. So it's a human evolves through learning. So this Tadvidya Sambhasha, okay, is always best for, Medo, or like to improve our knowledge. So that is the main reason why, we felt that we must conduct this international seminar, kind of symposia, so that our main focus was to bring people from different countries, and those who worked in Ayurveda, those who worked in other fields, those who worked in integrated manner, those who worked with some kind of specialty. You know, our idea was to bring all these people together and make this their knowledge available to the public, so that, you know, and what Ayurveda, is able to contribute. Of course, you know, everywhere we say in FB and other places we see success stories, these, that, but I felt that, you know, rather we felt that, you know, we must make a platform so that it can reach so many people. It can be evidence based. It can be like, you know, show to the to the public, and it can be show to the world that that we have done, really a great job with our knowledge, with our age old science, with the solid evidence and proof. That was the main idea. So that's why we proposed this, and we successfully we are inaugurating this today. So it is my privilege to extend a cheerful welcome to you all. Okay, so it's a proud moment to represent our Ayurveda College Coimbatore in association with Diksha e-learning, co-association with Jignasa, okay, Tamil Nadu, and I ask Ayush Tamil Nadu, and I wholeheartedly render our gratitude to our beloved trustee sir, who is a backbone of our institution, Dr. Sendil Ganesh sir, and our Secretary of Health Sciences, RVS group of institutions, Dr. Nagarani madam, okay, for their constant support. Okay, so this 4-day long convention is aimed at assessing the COVID-19 research activities and holistic approaches coordinated all over the globe, and their successful outcomes. This word I want, and their successful outcomes. So we want to really bring this one out. As I said, we all, everywhere we are speaking, we have done this, done Ayurveda is doing this, but what is the outcome? So we wanted to focus on this particular thing. We want to show to everyone that this is the outcome. So who are all worked in that, we contacted them. They were grateful, and I'm grateful to them. They all agreed happily, and I really welcome them. Many of them are not here, but still wholeheartedly I thank them and I welcome them for this session. Okay, and since the current situation is getting out of the frying pan and into the fire, it is our moral responsibility to render our helping hands. Okay, so of course the things are getting better. So hopefully, further I really pray Lord Dhanvantari to help us, or to help this suffering humankind, so that as soon as possible we come out of this dreadful COVID-19. Okay, so I consider it is a great honor to welcome our respectful dignitaries, Vaidya T.G. Vinod Kumar sir, okay, and Dr. G. Geeta Krishnan sir, and my beloved friend Dr. Somit Kumar, and all other eminent speakers for the upcoming sessions. Of course, I welcome all the participants who is here from all over the world and from all over India. As I said, students or the practitioners, teachers, elders, everyone. I welcome you wholeheartedly, to this session. And as I said, it's a Tadvidya Sambhasha. I really tell you, please, bring your, ideas. You bring your, your questions. So let us make it a success. Okay, let us make it as a Tadvidya Sambhasha. There is no ego. Okay, because nobody is above the God, or nobody is above anyone. As I said, we all learn from each other. So it is for our science. This is nothing to do with Ayurveda College Coimbatore, or it's nothing to do with Jignasa or Diksha. It is for our beloved science, Ayurveda. So I really, I appreciate, or I welcome your participation, as well as I welcome your question or your ideas, so that we can share it to everyone. Okay. So last but not the least, Karanasya Abhiraksha Karyartham Siddhyate. Okay. As we Ayurveda people always emphasize, without a Karana, there isn't Karyam. So you people are Karana, let me proudly tell you all that as soon as we come up with such an innovative initiations, we received vibrant responses from audience all over the globe. My heartful thanks to that. Okay, and so without further delay, let us dissolve into the ocean of Ayurvedic legacy to bring out an antidote to this pandemic era. Let us all unite together and explore our possibilities. Thank you, one and all. Thank you so much. I wish you all the best. Thank you. Have a good evening.
Thank you, sir. Now, to give the inaugural address, I would like to invite Vaidya TG Vinod Kumar, sir. Vaidya TG Vinod Kumar is a senior scientist at Ethnomedicine and Ethnopharmacology Division, Jawaharlal Nehru Tropical Botanic Garden and Research Institute. He is also the managing editor, Journal of Traditional and Folk Practices. Sir also serves as a member, Board of Governors, Central Council of Indian Medicine, Government of India, EC and Court member, Central University of Kerala. With that, I would like to invite Sir to this platform. Over to you, sir.
Namaste.
Namaste, sir.
Namaste. Am I audible? I hope I am audible.
Yes, sir. Yes, sir.
Yes, sir.
Yes, sir.
Thank you so much. First of all, I would like to thank, as it is arranged by Ayurveda College, Coimbatore. I don't think I need to say thank you, but I feel part of my home, but nevertheless, as a formality, I would like to thank everyone who is behind this, virtual conference, which is being inaugurated now. International Virtual Convention on Ayurveda and Research Advancement on COVID-19, a positive outgrowth. Respected everyone who is sitting here, who is listening to this, Dr. Chandramoulishwar and all who are listening to this. I just drove back from my office because hardly there is any connectivity there because of rains and things. So I drove really fast, around 50 minutes, in 40 kilometers in 50 minutes to reach for this particular function. And just I was recollecting the whole thing, what I need to say regarding this. And I was discussing this particular aspect with one of my colleagues there, who had participated or who is there doing as part of the CFLTC of COVID-19 program of the state. And I was just asking her how was her experience with treating as well as looking at patients with COVID-19, and she has been there since nearly a month. And she was saying it was quite a great experience because from patient to patient it differed. The symptoms differed, the condition differed, and so many factors were there. And she said it would have been better if Ayurveda was attempted at every stage of this particular disease as well. From there I want to start this, this particular, my short, talk. I was reading yesterday again on another, article. Let fever do its job. I will share you this particular with everyone after this. Probably I don't know which platform I should share, but I will share. But it's worth reading, and Ayurveda people must read this particular. I think it's a new one. Let fever do its job. That's the title of the article. The meaning of fever in the pandemic era. Don't worry, because everything has to come from foreign land, isn't it? From the West for us to accept. So this is also coming from Europe, done by Polish doctors and scientists, and there are more than 100 references quoted. It's a peer-reviewed article which has come in Evolution, Medicine, and Public Health 2021. It's a new one. I would recommend everyone to read this. Why? Because See, it is very clearly written. It's the concept of Ayurveda, which is they've also gone into, studied very well. And it's a good article where they're saying, although fever is one of the main presenting symptoms of COVID-19 infection, little public attention has been given to fever as an evolved defense. Evolved defense. Fever, the regulated increase in the body temperature, is part of the evolved systemic reaction to infection known as the acute phase response. The heat of fever augments the performance of immune cells, induces stress on pathogens and infected cells directly, and combines with other stresses to provide a non-specific immune defense. Observational trials in humans suggest a survival benefit from fever, and randomized trials published before COVID-19 do not support fever reduction in patients with infection. Like public health measures, that seems, it goes on. I don't want to read completely, but it is worth reading. And it goes on to say, with a very clear, presentation, with scientifically validated presentation on how fever actually helps in combating this virus, which is also well known to the Ayurvedic community. What temperature do pathogens actually experience? And it goes on why people take antipyretics. Fever suppression does not improve outcomes. Human intervention studies and early defense to flatten the curve in the infected individual. And finally, as conclusion, people with infection, people with infections have recurring concerns and seek medical guidance for fever, and also for aches and pains, depression, fatigue, and reduced appetite. We note the curious situation that biomedical science can promptly determine the exact genotype of infectious agents through advances in molecular biology, but we are still in the dark regarding our most ancient evolved responses to infection, since there is no currently accepted understanding of how the numerous seemingly harmful components of the acute phase response function together in defense. This should be a long-term research priority. More urgently, this pandemic is an opportunity to undertake a randomized controlled study on the effect of antipyretics on COVID-19 outcomes. Until that time, medical decision making should be guided by the precautionary principle to take reasonable steps to reduce risk to patients. It goes on. So what I mean to say is that, see how such scientific studies should come out to prove that even antipyretics may not be that beneficial for a COVID-19 condition. This is exactly what we do in Ayurveda. See, we don't treat all the COVID-19 patients in the same pattern. That's what I was told by my friend who had worked in CFTC, and also another doctor friend who had the whole family was infected by COVID-19, but for 4 persons the treatments in Ayurveda differed very much, because the symptoms were completely different. So why? Because see, sometimes we need to do the Agni Deepana, Amapachana, Lenghanam, then it comes to the symptoms, the lakshanas presented, and then the Nidana Parivarjana. See, this is how very classically, very scientifically, how Ayurveda attempts at this any infectious disease. Let us not go after the names, because now it could be corona, now tomorrow it could be corolla or something else, who knows. But this was the prime reason. I want to just say a few words, because even I feel bad, ashamed, rather even feeling what you call precarious, or what you call it as feeling dejected, even me as a physician, demoralized, to see that even after 15 months of the infection or this particular COVID-19 in world scenario, and particularly in India, Ayurvedic people have still to beg towards the authorities to allow them to practice or treat COVID-19, active COVID-19 patients. Of course, now asymptomatic, mild to moderate have been allowed. But had this been, I think very strongly feel that we are missing the bus. I've told very clearly to the concerned authorities very high up. And in fact, I think last month, had a discussion with our Honorable Secretary of Ministry of Ayush, and then, regarding, allowing at least Ayurveda colleges, more than 14 colleges, Ayurveda, Siddha, Unani. Why don't we allow Ayurveda college hospitals are there all over the country to start these COVID-19 patients? The professors, very qualified professors, associate professors, PhD students, MD students, even UG students, all are there. It would have been a great, advantage for the Ayurvedic fraternity or community to understand this disease as a whole, treating according to the condition of the person in their college hospitals, and then documenting it, and then presenting it, compiling it, and which would have become a repository or an authentic document in this condition as well. See, what everybody asked from a scientific community, I am a scientist working in a scientific research institute. I often interact with phytochemists, pharmacologists, and I often ask them, when one of the first antipyretic study was conducted with Kalmake, or what do you call it as Kidada Tikta, Antrographis paniculata, I used to ask my pharmacologist, sir, how do you determine the Rajasiga, Tamasiga, or bhava of the rat which we inject this, Antrographis extract into? Well, it was for a study, for a hepatoprotective study, but again, antipyretic study as well. See, I said, we even give in a feverish condition of a Vatiga Jwara, we can give Indugandha Ghrudam and like that. For a Vadiga Jwara, a feverish condition, which you called as, we give even a medicated ghee if it is necessary. So even COVID-19, I was told, there were patients who were presenting with the Kapaja Jwara, Vadiga Jwara, Paitiga Jwara, Sannibadiga Jwara, and different conditions of, these Jwaras. And do you treat with every patient, do you treat with Indugandhan Kashayam and Pajanamardhan Kashayam only? It depends. It differs according to the condition of the person. Because it is a very individualized, customized treatment protocol that we have in Ayurveda, we have to look at the condition of the person and treat accordingly. And then if a person has a Shwasa, then you give Shwasa, whether it is a Tamaga Shwasam or whatever, which dosha has been accumulated, whether there is a Amatvam in that condition or not, whether there is a Srodorotha, and then when it exceeds and it goes into the dhatu level, and even this clot condition, which they call it as, a clot in the artery or wherever it is in the brain, and then patient collapsing, it could be that, we can correlate it with the dosha entering into the dhatus and culminating in a very bad condition. And so imagine with, it will take a long time for me to explain all these things. But what I would like to sum up, or with what we Ayurvedic people should understand, I don't know whether other people are listening to, but for everybody's information, India was, I would say, still in the past sense, very advantageous condition. Well, I could say is still, with having this, time-tested, Ayurveda, Siddha, particularly Ayurveda and Siddha, and for treating these conditions. And it would have been through the Jnana platform way back in last year, April 2020, because of our continuous struggle, and even had a meeting with the Honorable Prime Minister to explain these things. Why Ayurveda should be introduced into this right from the beginning. Well, after a long fight, the central government, Ministry of Ayush did, publish a notification last year, April itself, allowing Ayurveda, Ayush streams to do treatments and research as well. So thanks to the Honorable Minister, the Secretary at that time itself, and subsequent so many, rules, regulations have come up. But as you all know, it's the health is a concurrent issue of a state. The states have to, allow this to happen. Some states have allowed, some states have not allowed. And you maybe you know that I was told that Dr. Tanuja Nesri is there coming in the valedictory session. Please ask her, because All India Institute of Ayurveda has conducted extensive studies on COVID-19, and they have come out with I was told, a good report. And Brahma Prakash Hospital and so many hospitals have, even in Coimbatore, if you ask Dr. Balakrishnan, they have also have very good results there as well. So documentation is the main part of any medical system, which we lack as Ayurvedic people. We have been saying this long, but please document whatever you have, and that is what that makes the basis for further studies as well. Even in Kerala, I was told nearly 3 lakhs patients were treated through Bheshajam, mild to moderate conditions of COVID-19, and amazing results are there, but yet to be published. I don't want to name the association, because there is a medical association which takes credit for all these things, and who thinks that they are the custodians of medical system in the country. I don't have much to say against that, because if you look all over the world, we can see that the pharmaceutical companies, big multinational pharmaceutical companies, do play a major role in controlling, in regulating, even I would say even regulating, or even monitoring, or even persuading, or even intimidating any government in that sense, because it runs into billions and billions of dollars invested into these research and medicines. Imagine, do you often ask any medical I'm not against modern medicine. I would say that when my mother my mother was conceiving me, in the my father was in the MBBS final degree, so I would say even my genetical code has an allopathic thing in my gene. So so having said that, I'm not against any other medical system, but that doesn't mean every medical system or any particular medical system has a role to play, or should be the medical system to be applied for any epidemic or pandemic in that way. No, need not be. Sometimes it could be Siddha, sometimes it could be Ayurveda, sometimes it could be homeopathy, which will be beneficial for a particular pandemic or epidemic. It should be tried. Why an epidemiological study is not conducted all over India in every state to study that which system of medicine really works for this particular pandemic? It should be done, number one. Number two, why autopsy or postmortem is not conducted on patients who had died of COVID-19? If it is due to an unknown etiology, causative factor, it is mandatory to conduct postmortem or autopsy. Then we will know why the cause of the death. It could be due to iatrogenic disease. Who knows? Who has said that it could not be? It may not be due to a particular over consumption of a particular antibiotic, or various steroids, or who knows? Who knows who has studied that whether mycomucosis or even this COVID-19 variations could be a resultant of probably plasma replacement, or where is remdesivir, ivermectin, all these medicines, or even hydroxychloroquine, which has been attempted all over the world and even in India. Where is the evidence? Where is the data to prove that it is effective for COVID-19? Where is it? And they say it is a very scientific medical system. I'm not questioning the scientificity of any medical system, but I would only say that the persons or the organizations or the association which is behind this lobby, I would say it's a lobby, it's a medical lobby which is controlling the medical systems all over the world and even in India. I would say they could be commission agents, who knows, and who will not allow Ayurveda and Siddha, a time-tested systems of medicine, which have seen enough and more pandemics and epidemics, and which have very constructively or even cured this condition. Even the last chikungunya, which I had been affected, I have also treated, and I know so many doctors, Ayurveda doctors, who have successfully treated and cured chikungunya. It's again a viral infection, and where even now there is no drug per se in modern medicine for that. So it is just like another flu. That's all. So the media, the hyper, sensationalization of these things, which are creating a lot of panic among citizens. It is really a concern that should not be allowed. Even the depression is a major concern. Again, coming to the post-COVID syndrome, what you call it as, who knows this post-COVID syndrome is only because purely because of the coronavirus. Who knows it is not due to a lot of medications, I would say unscientifically administered medicines by the biomedicine or Western medicine. Could it not be the causative factor for post-COVID syndrome? Who knows? So all these studies, please ask these questions. Don't be, don't go into defensive. You are particularly the youngsters who are listening to this, go on and ask these questions, pertinent questions to everyone. Otherwise, I would say, why have these systems still? Why not ban this system if it is not allowed to treat even a common flu or infectious condition? If it is not in India, where else you can do this? And I would again very strongly recommend, at least the second phase has passed, second wave has passed. This the Ayurveda and Siddha, like medical systems, should be allowed completely to treat in active COVID-19 phase. If it is allowed, at least I would say again, I even recommend an integrated approach where mild to moderate, asymptomatic, and all these conditions could be treated by all these these systems of medicine. And if at all a tertiary care is needed, a critical care is needed, then let alone that patients be referred to modern medicine. So the load on hospitals could be prevented, and could be minimized, and the economically also it will be viable for patients with COVID-19. As you can see, I would not say all the hospitals, but most of the hospitals, it ranges from 5,000 to 25,000 per day for treatment for COVID-19. Come on, all cannot afford this. So let us hope that, and this particular international conference would arrive at concrete solutions and recommendations to the government, whichever government you are talking to, and let us hope that productive output will be arrived at after this conference. Otherwise, it should not end as any other webinar or virtual conference. We have had enough of these conferences. There should be outcome oriented conference. So particularly the youngsters, I would say, don't get demoralized by seeing all these things. We will still hope for the best. Let us hope for the best. Let us hope that the people who are the decision makers will understand sooner or later that systems like Ayurveda, a whole system approach, which attempts at like Ayurveda, can do wonders, can be beneficial. And if we had a complete, this could have been a role model for the whole world. The whole world would have looked at, how effectively, Ayurveda is, not only controlling, even possible cure for COVID-19. This would have hit the headlines of, New York Times or, Washington Post much before. But let us hope, we can get over this and, do our best. So once again, I thank the organizers for inviting me, and I'm always there for for anything positive, anything constructive, and let us hope for the best. I would only say again, remind you, particularly the youngsters, it is not just the words. Okay, the words of Vivekananda, Uttishtada Jagrada Prapyavara Nibodhada. No doubt about that. Act. and you can do it. Vande Mataram.
Thank you, sir. It was really an excellent note, and it is always really inspiring to listening to you. Now, without any further delay, let us start today's first session. The session is by Dr. Geeta Krishnan, sir, on the topic Constructive Governance of COVID 19 through Integrative Strategy. Before going into the session, let me take the privilege of introducing Sir to this platform. Dr. G. Geeta Krishnan completed his UG and PG from Government Ayurveda College, Tiruvandhuram, Kerala. He is a senior consultant at Kerala Ayurveda and head of Department of Integrative Medicine at Medanta, the Medicity Hospital. He is his areas of expertise are integrative medicine, Ayurveda, yoga, botanical drug development, intellectual property rights on traditional medicine, and clinical trials. He is also the editor and executive board member of Journal of Ayurveda and Integrative Medicine. He is a member of scientific advisory committees of Regional Medical Research Center, Indian Institute of Integrative Medicine, and Central Council for Research in Ayurvedic Sciences. He creates interfaces for evidence based use of traditional medical knowledge in biomedicine research and practice. Now, before going into the session, I would like to go through a few of the basic instructions to be followed throughout the session. For an uninterrupted class session, use a laptop with high-speed internet connection. Please make sure your microphone is on mute to have a disturbance-free session. In case of any disruption, please check your internet connection first. And if the problem is within our network connection, kindly raise the issue in the chat box. Filling your full name to be displayed is appreciated. Any suggestions and queries can be sent in the chat box. Now, I would like to hand over the session to Sir. Over to you, Sir.
Am I audible?
Yes, sir.
Thank you. In fact, I think, Madam, you had, I was a bit late in sending my bio sketch, and probably you got it from the internet, which is something around 8-9 years old. So that's okay. I think that's perfectly okay. I now work with the World Health Organization of Geneva since the past 4 years. And I'm a technical officer in the traditional medicine unit of World Health Organization. Thanks. But rest of it, what you said was right. So just missed one part of it. That's all. In fact, this is a very good session which I am listening to, because there is a, on every day there is some kind of a meeting happening on COVID-19 and related issues, especially in the area of traditional medicine and Ayurveda and in many other sectors. And every day it's a learning process, and I'm extremely thankful to the organizers of the Ayurveda College of Coimbatore to have organized this International Convention of Ayurveda and Research Advances on COVID-19. Especially to Dr. Chandramouli, the principal, Dr. Vinod Kumar, who is a good friend and who just spoke before me, Dr. Somit Kumar, Dr. Tulya Mohandas, and dear friends and colleagues. This is a great time that I was allowed to speak to you and converse with you for about few minutes. I think that from the perspective of what I have been seeing across the globe about what is happening related to traditional medicine and COVID-19, I can say that there are few countries which have been utilizing traditional medicine very effectively in the management of COVID-19, or very few countries, not much. I should add a very to the friend of before the few, because if you look at the numbers of number of countries, we can find that it will be not more than 7 or 8 countries who had been regularly using traditional medicine. But if you keep aside the large number of countries within the African continent who were trying to use some form of herbal medicine in one way or other. So we have, looking at it, we have Thailand, we have China, we have Nepal, we have India, we have Sri Lanka, we have Madagascar, we have Ghana, South Africa, and very few countries in Iran, of course, and then some very few countries in South America, which includes Brazil and Argentina. So like these are the major countries which we can talk about, but out of which the most prominent one would be China. China had from the very beginning started using traditional Chinese medicine. If you look at the history of traditional Chinese medicines used in COVID-19, we can find that China started using traditional Chinese medicine in the management of COVID-19 as early as February, or like as early as February, March of 2020. So it is towards the beginning of the pandemic. It has not become a real pandemic in India at that time. It from that time onwards, China had been using it. And I don't want to make any suggestion regarding the numbers which is available from any country. So basically I would suggest that we need to understand that from the first protocol onwards, China had a common protocol for management of COVID, and it included traditional Chinese medicine. So that is something which we need to note and underline. That's something which I would like to address. And then if you look at Sri Lanka, of all the countries, if you look at Sri Lanka had used the traditional medicine practitioners in a very really useful manner. So Sri Lanka has two different kinds of health system. One is the clinic-based health system, and the other one is like the community health worker kind of a health system, where traditional medicine practitioners are the main pillars of this community health worker program. Like it's not exactly like our ASHA worker. It is like a community health worker who is also a doctor, kind of who can take clinical decisions, kind of thing. So this network of traditional medicine practitioners were extensively used by Sri Lanka to improve the improve the preventive measures and management of early phases of COVID. In Sri Lanka, of course, they did not use Ayurvedic medicines or Unani medicines or Siddha medicines in these by these doctors, but they used the health resource which was available to manage COVID. That is something which we should underline and look at. Madagascar, very early during the period of COVID-19, I think around April, May of 2020, identified that one of the herbs or a herbal concoction which was available in Madagascar could actually improve the outcomes in COVID-19 patients. And the president of Madagascar himself made this announcement to the world, and World Health Organization helped them to generate a research model out of it. And we also helped them to come together with, like, Africa doesn't have much of a research facility, so like we helped them to pool together resources from different countries within Africa. And the regional office of WHO in Africa played a major role in this activity. And then that drug is in the process of being developed in Africa still. It has not come out as a drug which is used extensively, but it is available in the market, in different countries in different names at this particular moment. Then in Brazil and Argentina also, several herbal remedies were tried, and there is a lot of documentation available there in the area of COVID-19 and traditional medicine use. Now, if you look at India, India has been a very interesting case, because if you look at the possibilities of what could have been done in India, even when it was not possible to do anything in India officially, with the available possibility, which was a very small nuance in the government of India's order of or the pre-existing order on pandemic management, and the rules which will be managing the country during the pandemic times. Government of India Ministry of Ayush actually published the protocol for prevention. This was quite unheard of. Actually, it happened even as early as April or May of 2020. The government then extensively informed that to the community, and there was considerable use of these medicines by the community. And we know that because the government itself did a major survey which included more than 500,000 people which was done through a mobile app. And they, I think, recently published that, not I think, I know that they have recently published that in a major journal also on the outcomes of the utility of Ayush related preventive medicines by the Indian population. So that was a major achievement. And then if you look at it, India has done several clinical trials in traditional medicine, especially in Ayurveda and Unani, Siddha, and yoga, even in so these clinical trials were well planned because there was a common machinery to look at the kind of structure of the clinical trials, where it was going to be done, what were the minimum criteria for making it into a clinical trial, the kind of clinical trial regulations which it had to follow, etc., etc. So and these clinical trials, where some of them were like probably 60 patients, covering 60 patients, but some of them covered 180,000 people, like. So these trials, which were on large population, on large cohorts, were really useful in identifying few medicines, let us say, for example, ashwagandha, or in terms of like Giloy and Pipali, and even in Samshamini Vadi, or like a few other medicines which we know right now are useful to be effective, and and to be more and more brought into the protocol of Government of India's management of COVID-19. And out of this, like one of the earlier interventions which came into the which had come out with a lot of data, or a lot of evidence of its usefulness, was the use of anutailam as a as a prophylactic measure. In application of anutailam in the nostril was supposed to be effective, but then was found to be effective even in the laboratory, by finding out that with the finding that it inhibits the COVID-19 vaccine by around 98%. So it was a wonderful finding, and I think a lot of Ayurvedic doctors started using it, and a community also started using it considerably or extensively. India also is doing a study on why and what did work and did not work during the COVID-19 pandemic for traditional medicine, especially for Ayush systems. And that is a study which is being supported by World Health Organization, and then also conducted along with Public Health Foundation of India and the Ministry of Ayush, the CRAS, and the World Health Organization is doing a survey-based study of 10 states across the country to find out the facilitators and barriers of usefulness of Ayush systems during the COVID-19. So I think once that study is over, and we will have a very good report on what supported, what prevented, and what would be the best way forward for utilizing traditional medicine in such conditions in coming times. I should keep you informed, or rather I should remind you that we never had an experience of a pandemic for the past, or even a epidemic of this proportion or this kind of a danger for the past, let us say, 100 years or so. Rather, no recorded evidence on our hand, like to follow through. Whereas China had that evidence, or rather, China had that experience, which happened during the SARS virus, epidemic, which happened in southern China, and also in Hong Kong and other places, where the government had to go through the preparedness of a viral flu-based or a flu virus-based pandemic, which could become very infective, as well as could become very fatal. So this information and this experience was there, and that was one of the things which allowed China to preemptively do a lot of things. And I can tell you, during the SARS COVID-19 process, also they used traditional Chinese medicine in the management of SARS COVID-19. But if you look at the way in which traditional medicine got introduced into the SARS COVID-19 management, you can find that it was much later in the SARS COVID-19 epidemic. So, it is very similar to our case. It is an experience on using something and its ability and its efficiency that allowed a government to take a decision on utilizing that in a similar situation when it came up in the future. So just to keep you aware of that. Now, I would also like to bring to your notice that there are several very brave and dedicated Ayush doctors in the country who are doing excellent job of treating COVID patients of different kinds, not only the mild to moderate, but, even severe, somebody who is being treated with severe conditions like severe hypoxia, and also treating COVID patients in COVID wards, in allopathic hospitals. So their experiences are extremely important, and I hope that some of them have started, or rather, I know that some of them have started writing case reports and case series on this. I hope that they will all be published very soon. And at the same time, I encourage and rather I am awed by the way in which these young and efficient doctors decided to risk their life, and for the sake of the country, for their fellow men, as well as for the science, and for knowledge, to create knowledge for all of us. So I salute them. They had no other support other than their own willpower to go ahead, and I think that they deserve the highest way of being recognized, or whichever way we can recognize them, they need to be recognized. I know doctors in Mumbai, in Bangalore, in Delhi, in Madhya Pradesh, where personally I know them, who are in Gujarat, like they are doing great job, and that is an excellent thing they have been doing. I would also like to bring to your notice that there are a few states in India which have done extremely well using traditional medicine. I would put on the first on the first column, I would put Gujarat. Gujarat had been extremely proactive in using traditional medicine, especially Ayurveda interventions and homeopathic interventions through the government system from the very beginning. Like not only in the first during the first wave, also during the second wave, and it had its effect and benefit. Madhya Pradesh also used traditional medicine, especially Ayurveda, in a considerable way. But I don't know, like whether I had to put Tamil Nadu also in the same category as Gujarat, because Tamil Nadu utilized the Siddha system of medicine with very great effectiveness. And one more thing which we should also applaud is that the Tamil Nadu government took the decision and made it mandatory that Siddha systems of medicine and the medicine of Siddha system, which is Kapasura Kudineer, should be distributed through all medical facilities, including modern medical facilities, during a period of the pandemic in the first wave, when the numbers were going very high in Tamil Nadu. So, and they found a good result, and and they were very proactive. I would really like to congratulate every one of our Siddha colleagues as well as Ayurvedic colleagues in Tamil Nadu who had taken this stand, and also the government of Tamil Nadu who had taken this great decision to move forward and and take traditional medicine as one of the major areas they can work with. Kerala has also, in a way, utilized traditional medicine considerably. I think Kerala has a lot of data available, which should talk quite a lot. Kerala had been a bit reluctant in getting or utilizing traditional medicine appropriately. I think that with the kind of resources and knowledge that Kerala has, we would imagine, or one would imagine, that Kerala would be the first state to stand out and say that we had been using traditional medicine in India, or Ayurveda in India, for the management of COVID-19. But I'm like they had used it, and there is considerable amount of data. And once the data comes out, I think it will be of great value to all of us, because the structure in which it has been done, especially by people like Dr. Raj Mohan and all, who I think is speaking tomorrow or one of these days in this conference, has been of great help in understanding how to utilize the Ayush resources appropriately during a pandemic. So so in a way, different states in India utilize the rules which were, or the protocols and the rules which were spelled out by the central government, and utilize traditional medicine in a good way to manage COVID-19. So this is what I would like to tell you regarding the the overall picture of how COVID-19 was managed across the globe by also within India, and in few also with the help of few individual doctors in this country, and in different parts of the world. So I had been asked to talk about constructive governance of COVID-19 through integrative strategy. So I had slightly, in my thought process, I have slightly altered the talk to constructive governance of epidemics and new emerging diseases through integrative strategy, lessons from COVID-19. Because I think COVID-19 is almost getting over. We might be at the last phase of the phase 2, and probably we might even have a phase 3, but I don't know how much of a change will happen during the phase 2 and phase 3 before the government takes a decision to include traditional medicine in an appropriate manner in the whole program. Probably there could be some states who would be more proactive now if there is a possibility of COVID-19, a third wave of COVID-19, and utilize traditional medicine more appropriately. But I think this is a learning for us. Like the SARS-CoV virus was a learning process for China in 2003. This is 2019, 20, and 21 is a learning curve for India, like all of us. It is for the Indian system, it's for the Indian people, as well as it's for the Indian traditional medicine community and the medical community. We need to know that there are certain ways in which we could have improved our outcomes much better, and we could have stood tall in many situations. I'm not saying that we are not standing tall yet, like we are still standing very tall as far as the total outcome of the COVID-19 across the globe is looked at. We probably will rank very high in the outcome. Of course, we had a terrible wave of the terrible second wave and its outcome. But basically, if you look at the overall picture, we still stand very high in the outcomes of COVID-19. But what I, again, coming back to the title or the theme of this particular talk, I would like to say, when we talk about constructive governance, constructive governance is prospectively progressive. I hope you understand what I mean. Constructive governance is something not set in cement. That is the most important element of something which is a constructive governance model. Constructive governance keep on improving as more and more better situations evolve, and it is a progressive way of to achieve a better outcome. So that's it does not a constructive governance. The first thing is, constructive governance does not have a definite structure. It starts somewhere and probably ends up in a totally different situation, but it is progressive and it is prospective. It keeps on moving forward. Now, this moving forward is based on evidence, and it also relies very strongly on effective implementation of the governance decisions, as well as monitoring, review, and of course, course correction. That course correction is what builds a constructive governance. So when we say constructive governance, and of course, integrative strategy is not much different from what we have been talking about constructive governance. From my experience of working in an integrative medical facility for about 10 years and managing it, I can tell you that integrative medicine is nothing other than using the best possible resources for the best possible outcome. It is nothing more than that. Keep an open mind, look at all available resources, find out what your endpoint is, which is of course the patient's benefit, and then see what you can bring together in the best manner possible so that patient benefits. That's how integrative medicine is. That's how constructive governance is. The difference between constructive governance and integrative strategy is that integrative strategy can be a part of constructive governance, and constructive governance grow out of integrative strategy. So this is our experiences from integrative strategies. This is the slight difference between the two. And we have to also understand that, like if you're going to look at the future, we should look at epidemics and new emerging diseases. One of, I can tell you, like, a few of my friends very, very young friends in Kerala had called me, like, because I was probably in WHO, they called me and asked whether we could put an influence in the government of Kerala to use Ayurveda in the area when Nipah virus was there, like in early 2018. or rather mid of 2018, when Nipah virus happened in the infection happened in Kerala, northern part of Kerala. These young doctors wanted to introduce Ayurveda in the Nipah virus management. It was, I told them that we don't have evidence for support for a government policy level decision at that time, but the best evidence that could be created would be to work on common cold and make sure that we are able to manage viral disorders and viral disorders of epidemic proportions, and then say, okay, we are able to reduce, like every year during rainy season or just after rainy season or before rainy season, Kerala gets into a viral fever epidemic, and then after that there could be possibly dengue epidemic, or there could also be a possibility of chikungunya epidemic. So if you are able to show that by the interventions of Ayurveda, we are able to reduce the infectivity of these viral diseases, the spread of these viral diseases, the severity of these viral diseases, then we have a say to say in the government, saying that, okay, we know how to manage viral diseases, we know these are situations, these are the outcomes that we are able to provide. So therefore we have the right to look at how we could probably manage Nipah virus. If you don't have that, if you don't have that data, if you don't have that information in our hands, which a policymaker who most probably is not a medical person, who can read it simply and understand, okay, this particular intervention seems to be beneficial for the community, we will not be able to make a change in this particular aspect. So it's a kind of essentiality. So I'm just bringing that up because if you are going to look at the future instead of COVID-19, or even if you're looking at the later phase of COVID-19 infection, COVID-19 pandemic, then we require to have some idea, a strategy which we need to roll out for Ayush systems or Ayurveda to manage epidemics and new emerging diseases. That's what I meant. So what would a constructive or what would an integrative strategy be for or a constructive governance be looking like for COVID-19? Let us think that we are at the beginning of 2020 and we are finding COVID-19 in our country for the first time. What would we do? What are the things that we should have done? What would have made it better, or how it could have been, is something which I want to think about. I'm not trying to present anything because I don't have any evidence to say that this is how it could have been, but I can tell you, I can take you through a imaginary landscape where I think how it could have developed. Like before that, I would like to also bring to you, when I again and again say evidence, what do we mean by evidence? Is something which we all need to look at. We all say we don't have evidence, or we say evidence based. So somebody says your evidence is not evidence. So what is evidence? Evidence is something which we need to really go back and look at, because evidence is definitely not what is found effective in the laboratory and what is not found effective. The same thing, if it is not found effective in clinical practice, then it is not evidence. Whereas what we are finding effective in clinical practice, and we do not have an effective a supportive mechanism of action, or supportive laboratory data available with us, then that also is somehow becoming not an evidence. I don't know whether I am clear about it. What I want to say is, evidence is anything that takes a sick person, or in medical community, a sick person from point A to a point B. So anything that takes a person, a human being, from point A to point B repeatedly, over and over, in different situations, is an effective medicine. That is the evidence. The evidence is what? What is evidence? Evidence is the movement of moving a person from point A to point B in his or her health status is what is called as evidence. And anything that is capable of doing that is evidence-based. So that is what we have to strive to achieve. Now, what we are saying is, most of the time evidence becomes something in between from point A to point B. So somebody says that you use a particular chemical, it will hopefully take you to point B, and then they give you a lot of pictures and and a lot of structures and all chemical bonds, atoms and neutrons, and if possible even up to they can even think about a fission happening within an atom to say that something happens, something clinically relevant will happen. But at the end of the day, it doesn't happen. Then that was what has happened with remdesivir. Like it was such a hype before, during at a particular time in pandemic, we all read that there is a Chinese company who is investing in it. Anthony Fauci is investing in it, like and there were a lot of conspiracy theories saying that this COVID-19 has been already the medicine of COVID-19 is already known, it is already done, and this only thing, the patent has to come out, and everyone was waiting for this medicine. And what happened with that? Once it came out, it didn't work. So what is evidence? You had a lot of evidence which said that a particular material or a particular intervention could take a person from point A to possibly take a person from point A to point B. And it did not work. But you considered everything in between, which was all in paper and in laboratory, as evidence. Then there is another situation where you say that you give Samshamani Vadi to a patient, and the patient will come out of the hospital before seventh or eighth day, and in comparison to a group of patients who will get into a hospital with the similar kind of condition, who will come out usually at the 11th or 12th day. This is what we find out in many studies. Then we know that this Samshamani Vadi takes a patient from point A to point B, but we do not know what is happening in between. So what happens? That does not become evidence, like that is not considered as evidence. So I think there is a major problem in identifying what is evidence, in our asserting or ascertaining that this is evidence, and making sure that the scientific community accepts, or the general community. Let us forget about the scientific community or the so-called scientific community. Let us talk about the population and the societies. The societies accept and understand that what works on humans and improving what works and improves a human health, a human being's health, is what is evidence, or what is useful, and what should be considered as that particular product or intervention should be considered as evidence-based. What works possibly in a laboratory, but possibly and does not work in real time, does not really constitute evidence, or is not evidence-based. So this somehow we need to work on, because we still work again, go back to the same situation. We still keep on and talk. When I say traditional, when I say we, I mean traditional medicine always goes back and says that okay, when somebody says you don't have an evidence, we try to create evidence by creating all the mechanisms, trying to find out all the mechanisms of action, whereas evidence actually is taking a patient from point A to point B. That we are able to do. What we are able to do not do is how we are taking that, how that intervention is taking that patient from point A to point B. So I think that is where we need to now concentrate and do a lot of work. So anyway, let me take you back to this this landscape which I was talking about. So what would have happened, like if COVID-19 had happened and we were prepared and we had an open mind on using traditional medicine, when COVID-19 with an R naught of something around 3.8 or more happens, we know that it's going to be a pandemic, and it is going to be its infectivity rate is quite high. People are going to be infected very high, it's possibly airborne, or by that time we knew that it was a very very it could be infecting people within closed spaces, etc. So we know that it's going to be a dangerous situation. What do? We have caution. So that is the first thing. When you encounter a new disease, have caution. That's the most important thing. Find out how is this disease transmitted, how could you contract a disease, how many people can contract the disease. Take the precautions. And that's what we should do. And I think most of the governments did that, like that was very good. And that reduced the speed at which the virus could transmit and cause the disease. That's something which is very clear. Then the second option or second step is to understand the disease, understand the character of the disease, how many days it takes the disease to be full blown, how many days is the incubation period, which which are the organs it affects, which are the signs and symptoms it develops, which is the dosha which it is going to cause, what kind of combinations of dosha it has, or etc. Like we need to identify all these, and that is a second phase. And I think we are still learning, because it's an evolving virus and its characters also keep on changing. So we are learning it, but we know much more than what we knew in the early part of even like 1 year before, in June 2020 and June 2021. Then the amount of knowledge we have about the character of the disease is quite different. We have lot of information about the disease by this time, and we know how it would act, what are the problems, which way it acts, what kind of a problem it causes to the blood vessels, to the lungs, to the fibrosis of the lungs. What we feel as like liquid filled lungs is not liquid filled lungs, it is something else. So all these issues, we know about the cytokine storm. So all these things we know. So we also know that in a manner the disease is of vada kapadiga Sannipadiga in nature, and it can include Paitika condition. Then the symptoms could be slightly different, and the variations of Prakriti itself can have a different kind of an outcome for the patient. So all these things, due to different people studying on it, we know. We also know that there are several herbal medicines or like interventions which can also be very useful in the disease management. So this is what we do by understanding the disease. But understanding the disease cannot only be from one system of medicine, it has to be from all systems of medicine, because like different people have different perspectives. So when we try to go to a new place and study a new place, we just do not send one person with one perspective to understand that place, or to study the culture of a place. We actually send different people with different perspectives to study that. We study the writings of different people with different perspectives to understand what the culture of a place is. Similar is a disease. Disease is something which is an interaction between the host and the invading organism. So it's a change which happens due to the interaction between two systems. And to study that, there are different ways of studying it. It is not only one single system-based study. It could be different ways of understanding it. If you look at it retrospectively, in a way, we were a bit late in bringing in traditional medicine into studying the characteristics of the disease. But in an ideal world, all the systems, whichever is available in this community, should be allowed to study the character of the disease. And then we should also look at the options for treatment, look at what are the available options in modern medicine or in other traditional system of medicine. If you look at it in that manner, I would say that traditional medicines would have been the first one to have started treating COVID-19, because traditional medicines, once they understood, or especially Ayurveda and Siddha system of medicine, or Unani system of medicine, or even homeopathy, after understanding the character of the disease, had a definite medicine to offer for the disease. Whereas after understanding all the characteristics of the disease, modern medicine had to say that they didn't have any medicine at that particular moment, so they have to look for it. So these are two different aspects of it. So one would say that, okay, you are saying blindly that traditional medicine is saying blindly that we have a medicine for it, and modern medicine is telling the truth. The fact is, both aspects are truths, are from different perspectives. That's what I said. This both perspectives should be taken into consideration if you are trying to create a constructive governance model for this particular pandemic. That should have been the right way. So when Ayurveda, homeopathy, or Unani says that this particular condition we will be able to treat, we should have been allowed to treat them, and manage those cases. It would have improved the way in which we could have treated and managed this pandemic, and that is something which we lack. But in a future case, that should be the possible way in which we should be looking at it. And we should also understand that, when we look at interventions, we should always remember that what works in United States and Germany need not work in Uttarakhand and Jamshedpur. It doesn't work like that. So sometimes, you can find that some medicines work extremely well. The simplest example is the use of ivermectin in India. There are a lot of studies in India which says that it is useful. There are a lot of studies outside India which says it is not useful. What do we select? What do we take? How do we use it? This is a problem. So I'm talking about in modern medical sense. So what works in modern medicine outside India need not work in modern medicine even within India. So within India itself, there are different characteristics of people. People have different ways in which they respond to medicines, and we do not know what is yet working, what is not working. But what we know is that there are certain Ayush medicine, specifically Ayurveda, Unani, Siddha medicine, specifically Ayurveda medicines, and some certain Siddha medicines that really works, in very specific situations, well-defined conditions of the disease. That is something which we know for sure. So can we, when there is no intervention available, as in a constructive and integrative model, those medicines should be immediately introduced into the system so that there is an effective outcome for the patient and in the population. That is a constructive model of, or constructively governing a pandemic, because you in one situation, what you are relying on has nothing to offer, and in another situation, what you had been testing has something to offer. This is the most logical thing, is to use what you have something to offer. Even if it is very little, that is what we should use. That is a way in which an integrative approach should be, and that is the way in which integrative approaches are, and that is how it becomes successful. So that is something which we should look into. But at the same time, we should also understand that from a critical point of view of a governance structuring, we should understand, we should also critically look at our capabilities, or traditional systems capabilities, or any resources capabilities, because the capability of the resources depend upon the already existing resources that these systems have, the skill sets the systems have, and also how effectively they have an administrative network set up. That is also very important, because these three are the most core functional elements of any public health. Because if you want resources, you want skills, and then you have to have an administrative network of implementation. So we have to look at that. And if you look at that in the area of traditional medicine, very few states in India have that capability. And if you look at which are the states who had used the traditional medicine in the best manner, you will find that those states have these systems well in place, and that is why they have used the traditional medicine quite well, even up to Kerala. So this is something which we need to understand. Well, this one is a policy decision, but a policy decision is taken upon the capability of something to deliver, even though however effective it might be. Like, for example, the medicine or the vaccination from Israel, or or the medicine for COVID-19, the what's it called, the medicine for COVID-19 from Israel, even though it is very effective, but we don't have enough medicine in hand or resources in hand to distribute it across the country. Let us take, for example, the vaccination, the case of vaccination. We know that vaccination is effective, but to vaccinate 1,380 million people in India, it takes years, it takes time. It is not, we have already vaccinated more than the total population of USA. Probably we would have added another Europe to it also by this time. But basically, we still have a large number of people to look at, and so we need to find out whether, if you're creating a constructive governance for pandemic management, we require to have resources. So resources cannot be built at the last moment. You cannot go and build your resources when a pandemic is striking. You cannot build an arsenal of weapon when the war is knocking on your door. You cannot do that. You have to be readied with that. You have to work from the very beginning. So that resources building is something which the Ayush sector has to take up. The skill development also Ayush sector has to considerably look into, and also the administrative models which can make sure that implementation happens in the appropriate manner should also be built into. We lack in that. So that is something which we should look at. And once we know that something is effective, something needs to be done, we need to look at we need to divide the resources, as divide the work, the responsibility, and the resources. When I say, I mean the finance, the infrastructure, and the manpower should be divided as per the available resources and the ability of the resources. After evaluating the resources for its ability to perform, you should divide them and support them with finance, as well as with infrastructure, as well as with manpower. That's something which is very essential. And once we do that, then once this basic, initial evidence based like interventions have happened, then we start collecting evidence, evidence based on outcomes. That is what we start, that is where we start the evidence collection. Evidence collection should be for betterment of any outcome that has come, which was good in a COVID patient. And then it should also be for supporting integrated use between different systems and different resources. For example, let us imagine in an imaginary world where 95% of the COVID patients do not need, or let us say 90% of the COVID patients do not require a hospital bed. And all such patients, until a very specific criteria of referral, were taken care of by Ayush systems, only 10% or less than 10%, or probably about 5 to 7% of the people would have ended up in the hospital. Can you imagine the kind of relief the health system would have had if the entire 93% of the population were managed with simple medicine by Ayush system across the country? We have enough people for that. We have enough number of medicines for that. We have the capability of doing that. Only thing is that we didn't have the way in which to implement it. We didn't have the decision to implement it. I think had that happened, the many of the sequel of like stress which had happened to the of the stress which had happened to the health system itself, the hospitals itself, the long queues for oxygen and hypoxic conditions which we saw, would not have happened. That is something for an assured thing. So I think we missed out on that, and we probably should never miss out on such an opportunity. It is not an opportunity for Ayurveda or homeopathy. This is an opportunity for the community to keep themselves away from harm by using the best resources that they themselves have created. Don't look at us as a separate thing from the society. We are all part of the society. The society, the Indian society had created us or made us what we are. And why did they create us or made us what we are? So that they could use us when they wanted. But creating us as a skilled manpower and skilled and possible infrastructure and not utilizing it is definitely not constructive governance. That is something which I can say. So just imagine like how integrative practice could have been. Like the integrative practice in health system level could have been 90% of the patients who don't require critical hospitalized care being treated by Ayush doctors across the country at their home for symptoms. That is one. Two, patients who go into severity and who reaches conditions where modern medicine couldn't do anything, cannot do anything, being treated through an integrative approach using Ayurveda. That is something which is happening right now. That's what I'm saying. I know doctors who are treating COVID patients who had been on 14 days in the ICU, in ventilator, on oxygen support, just about to be dead, but being revived through Ayurvedic medicines. This is something which we know for sure. So how great it would have been, how wonderful it would have been. As Dr. Vinod said, it would have been the main news in many of the newspapers across the globe. But that is not important, but that is not our purpose. Our purpose is we could have served more life. We could have improved the condition and the outcome of the pandemic within the society. We would have been a more proud society. We would have become a more important, more self-respecting society by having done that. And we lost that, but we should learn from that loss. That's what I'm saying. Crying over what is lost is no use, but we should learn, and we should prepare ourselves, and we should prepare our community and our governments to accept this fact and then move forward. And I would also say the outcome assessment of a pandemic of any system should be a common outcome assessment. It cannot be one kind of an assessment for modern medicine and another kind of an assessment for traditional medicine or Ayurveda, because outcome is, as I said, point A to point B. Move a patient from point A to point B. It can be different stages of the disease. So Ayurveda is able to move a patient from point A to point B in early phases of the disease. Then Ayurveda do not get enter into the practice at all. For let us say severity, high severity, etc. For some time there is no Ayurveda. Then comes a situation where there is the patient cannot be revived, or in a kind of a situation where patient is in a highly critical condition where modern medicines, whatever is known to them, do not work. And at that time also there is a possibility of Ayurveda to enter. I'm talking about an integrated approach. I'm not talking about an Ayurveda management of COVID-19. So do not think that I do not approve of Ayurveda managing the entire spectrum of COVID patient. I'm talking about from a governance perspective, using the resources in the best manner possible. This is what would be ideal thing. Like 90% of the patients treated through Ayush systems, 10% who get into the hospital treated by modern medicine. If things go worse, and if modern medicine cannot do in a situations, try integrative approach of different kinds, and try to bring them out, bring the patients out, save their life. This is what we should be doing. And of course, these course corrections which will help us to build a governance, constructive governance is also something which we need to understand. This is not, as I said, written in stone, and etched in stone, and which cannot be changed. It starts somewhere. It has only one aim, to the betterment of the people in terms of outcomes of managing a specific disease. Use all resources, be agile, be resilient, and have a plan, but do not say that this plan cannot change. This is how you build a integrative program. This is exactly how you build an integrative clinical management protocol for any disease also. Like, you cannot have a exact plan. There is no exact clear-cut plan in an integrative medicine program. Integrative medicine program varies always with the necessity of the patient. As the patient varies, the protocol can vary. So I used to call it the fluid protocols. So we have a general idea of a protocol, but it is not. It is a fluid protocol. It contains everything, but it can take its own shape as per the requirement of the particular condition. So we want fluid protocols and and people who can understand the fluid protocol, and people who can understand the dimensions of using fluid protocols or different protocols together for the best of the patients. So I hope that I hope that I was able to take you through a landscape of how a pandemic should be managed, or governed. The governance of management of a pandemic should be, if future pandemics happen. I think that we have learned a lot. We probably were many a time standing outside and looking, but we were all intensely watching. So we have learned a lot. We have a lot to gather ourselves for. We have to make sure that we are prepared for the next one. We have to make sure that we are prepared for treating the next pandemic. And that does not, what I want to underline and say, that does not start with the pandemic. If you want to start treating a pandemic, getting involved in a pandemic, start treating, especially a viral pandemic of the type of COVID-19, start treating common cold. That's what we should do. Say that we are able to reduce the incidence of common cold from 30% to 10% in 3 consecutive years due to specific interventions of Ayush systems. Then we have a say. We hopefully should be able to do that. We hopefully should be able to convince the government. We should be able to produce proper reports. We should be able to tell how effective Ayurveda had been to the community. We should work on the evidence. We should work on the concept of evidence. Make sure that people understand that evidence is not laboratory reports. Evidence is what takes a person from one point to the other point in a safe manner. I would conclude by saying that health systems should be pluralistic. Of course, it should be like in India, and public health should be for the public. It should not be for specific systems. That's what I have to say. Thank you so much.
Thank you, sir. It was really wonderful listening to you. It was really informative as well. And I hope the participants are also enlightened with this. If the participants have any questions to ask to sir, they can post it in the chat box now.
Sir, namaste. Chandramouli, sir. Principal. Thank you, sir. Thank you very much, sir.
Thank you.
Thank you, sir. Any questions from participants? So which drug did you mention in the beginning of the session?
They used it in Madagascar. I think that's what she is asking, sir.
Yeah, like, it is a herbal medicine from Madagascar. They have not disclosed the medicine yet, so it's a combination which they use within Madagascar. So that's what we know. So
Okay, sir. Any more questions? Participants are requested to post their questions in the chat box.
Unmute soon, Dr. Surya Narayana. He has some question.
Yes, sir.
Sri Lakshmi.
Yes, sir.
Sir, good evening, sir.
evening.
Sir, good evening.
Good evening. Good evening.
Sir, Arthodavaska can be given in the first line of treatment of the COVID?
I think so. There had been a study on that, no? Like there is a study on that which says that it is useful. So I think very specifics I do not know. So if you are asking me whether there has been a study on that and what has been the outcome, I know that there was a study, but I do not remember the outcome of it. I'm sorry. So probably somebody else who will be speaking after me would be able to tell that.
Acha. Thank you, sir.
Thank you, sir. So we have Dr. Deepika with a question.
Yes, Dr. Deepika.
We request Dr. Deepika to unmute to ask her question. I think she's having some network issues, sir. We request Dr. Deepika to post her question in the chat box so it can be discussed. So how many drugs in Ayurveda can treat COVID?
I think if you look at the number, different kinds of treatments which have been given in Ayurveda, more than 50 drugs could be named, but they are not, if you're an Ayurvedic doctor, you might know that Ayurveda does not have one single medicine for the disease. So it is based on the condition of the patient that the medicine has to be given. And there are different medicines which are used as per different conditions. So from prevention to early phase of the disease to conditions which are useful in prophylactic management, in severe conditions, and even in hypoxic conditions, there are different medicines which are used. So starting from ashwagandha to Giloy plus Pipali, to like Hemagarbha Potali. So there are different medicines which are used. So I think and even Khudapana and and even for some people, even Vamana are also being performed by certain doctors. So I think one set of medicine or how many medicine is not a question which I can answer, but I can tell you that there are several medicines, and depending upon the different conditions of the patient, different medicines are used.
Okay, sir. Thank you, sir. So there's another question. So how Rasayana medicines can be incorporated into the COVID management?
Yeah, I think it should be post-COVID management situation, or every post-COVID patient should get an Ayurvedic Rasayana therapy, or rather medicines which can help them to improve. Of course, as a Rasayana medication, but even Sahasrabudi Abhraga is also given. Abhraga Basma is also given as a Rasayana for post-COVID patients. There are few medicines which are given in early phase of COVID-19, which have the end name as Rasayana, like which is like, I think Gandhaka Rasayana, etc. I think somebody had written it also here somewhere. I saw that. Yeah.
Yes, sir. Gandhaka Rasayana can be advisable in moderate cases. How many days we have to continue?
I'm the wrong person to ask that, like, so I cannot tell you that. I think you should ask somebody who had been treating patients with Gandhaka Rasayana. I have not used that. So.
Okay, sir. And there is another question about the black fungus, sir. How can we Ayurvedic treatment can help for black fungus?
Black fungus usually happens, or rather happens, because of the low immune system and the change in the microbiome environment within the body. So I think Ayurveda can improve basically from the point of view of acne, and improve the resilience of the person to keep his or her immunity strong, and keep the microbiome without much of a change, which will be the best option for preventing black fungus infection. But at the same time, if you have that, I understand that a few of my friends have treated black fungus with Rasagandhi Meduga and all. So, but even then, I think I will be speaking from somebody else's knowledge. So I think I'm not comfortable in answering that. But I know I can specifically say that Rasagandhi Meduga has been used in the management of black fungus by a few of the Ayurvedic doctors. But you need to ask doctors who are directly treating them. I think like probably Dr. Somit or Dr. Ram Manohar, when they are speaking in this conference, they should be asked this question, because they directly deal with doctors who are treating patients of these conditions. So I think I'm not the right person to answer that.
Okay, sir. So there are patients complaining of adverse effects of Ayush Kwath, which was extensively promoted by the government. What is your view into this?
I think there are problems which can happen when you give a single group of medicines as a common thing for everyone to take. Many people had benefited, many people had difficulties after taking the medicine. That's for sure. But the thing which we have to look at is from looking at it from far off. What I can tell you is that intervention was a timely one. Otherwise there would not have been any intervention of Ayush in the system at all, in the health system within India at all at that time. So it allowed the possibility for other medicines to come in. So probably Ayush Kada would only have been a primer, and would have been given out as a preventive medicine or preventive intervention. But since people started using it, and some people benefited from it, there was a lot of discussion, and it allowed other medications to come into the system. So from a constructive governance point of view, that was a very good intervention. But from a clinical practitioner point of view, and very specific to patients, very specific patients, probably many patients had problems with that. The quantity of medicines which were of acne in nature was quite high. So many people had gastritis, etc. That's for sure. And then the climate in India also changed. So we started using that in the early April, and then it became summer in all over India, and many people had problems with that. So I think that is there. I don't ignore that, that fact that giving a common medicine to 1.3 billion people will always have problems. Even if you give anything, you can give anything, you can give honey also, and still many people will have problems. But that helped in allowing Ayush systems a kind of a say, or putting your foot in the door, so that the door doesn't close. That was a footholder for us.
Okay, sir. So when it comes to clinical trial in Ayurveda, reproducibility is an issue. How can we address this? And do you consider Prakriti of a person as an effect on modifier?
It could be. I think reproducibility is an issue most probably because of the methodology, not because of Ayurveda as such. I think that is something which we need to look at. So probably if you want to have reproducible research, you should have reproducible methodology which is followed, and that is something which we really rarely do. So I think like we need to rephrase the question: how do we improve our methodology of research so that our answers or the outcomes are almost always the same, like, so that is how I would look at it, because it is not that for example, Rasnerendadi Kashayam, if most of you are Ayurvedic doctors, Rasnerendadi Kashayam given it a very specific condition in rheumatoid arthritis definitely works. It works and it works and it works and it works. There's no doubt about it. But then you change the methodology, and then you try to find out a different group of patients, or you take the whole spectrum of rheumatoid arthritis and then use Rasnerendadi Kashayam in a different group of rheumatoid arthritis patients, and then say that it is not working. So then it is not reproducible. So these problems are there. So we need to identify, and we need to tighten our methodology of research, and I think that's the most important part, to have definite outcomes in research. And that's what I think research is, like following up a correct methodology.
Okay, sir. Thank you, sir. Sir, does modern vaccination affects Ayurveda medicine intake?
There's a study which is going to happen on ashwagandha and post-vaccinated patients with like in their prophylaxis of, like, in post-vaccinated breakthrough cases of COVID and ashwagandha. So that is something which is happening right now. We do not have an outcome for it. So that study is being planned, and it has been approved. So it's being done in a large scale supported by Government of India and ICMR and CSIR. So I think once we have the result, we will be able to say that. But otherwise, I think vaccination does not have much of a negative or positive effect on Ayurvedic medicines. This is probably a wrong statement to make. I do not know. It's a truth.
Okay, sir. Thank you, sir. So, can Swarna Prashanam should be a part of the standard vaccination program? What is your opinion, sir?
Sonaprashanam is very definitely shown to effectively prevent vaccinatable or diseases which are prevented through vaccine. Sonaprashanam should be included in. But what is additional benefit that we are giving by giving Sonaprashanam to hundreds of millions of children? We need to identify that. That is our job. If you want to promote Sonaprashanam as a vaccination program, then we need to find out what Sonaprashanam is for. What is it useful for? What specificity that it has, or is it an alternative vaccination? Because that is how it is being promoted. So I think we need to do some work on that.
Okay, sir. Thank you, sir. So with that, we'll end the discussion session. Thank you, sir. It was really a very informative session, and it was very informative listening to you. Thank you for inspiring us. And with that, we come to an end of sir's session. Shall we move on to the next session, sir?
Thank you.
Thank you, sir.
Thank you, sir, once again for the wonderful session. Now we have Dr. Chandra Maulishwaran, Principal, Ayurveda College, Coimbatore, to give an insight into COVID-19 treatment at Ayurveda College, Coimbatore. Over to you, sir.
Good evening, everyone. Actually, it's we never planned this session because today we planned for Dr. Geeta Krishnan sir and Somit sir, but due to the time gap, Somit sir is on the way, and I think he's present also. So Geeta Krishnan sir said that he need only this much time because he has some other appointments also. So in between we have some 20-25 minutes, I think. So I thought this time we can utilize in the practical way, because we started a COVID center in our college in the month of June, the month of April. So we started at the April end. Up to now, we have admitted more than 15 or 16 cases, and some 5 to 6 post-COVID cases also. So I thought I would share, my little knowledge, because there are some students also there. So what kind of cases we have done here. And of course, as Vinod sir said, we are documenting it properly, and we have wonderful internees. They are, documenting everything 3 to 4 times a day, and so basically, I would like to start this session. I didn't prepare any PPT or anything. Just I thought I will just engage. So basically, if you see, I would like to start a session with this wonderful quotation from Charkacharya. Okay, this Vikara nama kushalo na jihniya katachana nahi sarva vikara nam namato asti dravam. So basically, if you don't name, or if you don't know the name of the particular disease, you don't need to feel bad, or you don't need to feel shy, and you don't need to question yourself that, oh no, I don't know the name of this disease. Okay, so he says nahi sarvaganam namato astin. Can you name the disease? Because the disease is innumerable. You can see so many years back the acharyas have taught about it. They would know that in future there could be number of diseases. We may not name them. That's what this beautiful 1-line 2-line quotation states, that we may not name all the diseases, but for that you don't need to feel bad, because you cannot name every disease. You cannot give the name to every disease, because the disease is infinite, as simple as that. So there only this vikalpa samprapti. When we talk about the treatment, trust me, without diagnosis, without samprapti, because samprapti vikatamayava chikitsa. So breaking the samprapti, or breaking the dosha dosya samurchana, or breaking the pathogenesis. So without understanding and without breaking a pathogenesis, the treatment will not be successful. That's why Charkacharya said about different sampraptis. So there, this Viti samprapti plays a very important role in treatment, according to me, because doshanam amsamsha kalpana. So if you know the amsamsha kalpana, because every dosha has their own set of qualities, and when you are treating, you must know in particular dosha which quality is affected, and accordingly you choose the drug or the treatment and give. The treatment will be very successful. This is the very basic. That's what my understanding is. So this Vidhi Samprapti is very, very important in treating the COVID cases. As I said, Ayurveda, as in many scholarly people also already saying, Ayurveda is a unique system. It talks about basically Prakriti, the nature, then Vikriti. That's the reason why you cannot, and I don't think that Joram means you just give Sudarshanavati to everyone, or you have Vettamaran to everyone. It's not like that. That's why they told so many kashayas. You see, if Vatahara Thailams are so much, you have Danvantaram, you have Sahacharadi, you have Katamchukadi, you have Parmanjaram, you have Chinchadi, you have Sahaj, so many. Why? They could have said that put all the Vata, anti-Vata drugs and make a Vata Thailam or Pitta Thailam and Kapha Thailam, because I had some of my students, though, I taught some of the students from foreign countries when I was working in Kunnur. So they used to ask, why this much Vikalpam? That is the beauty of Ayurveda. Why? Because, people ask treatment protocol for COVID. Of course, to make the scientific community to understand this treatment protocol is very, very important. And we try to come with one protocol and try to say, this is helpful in this. According to me, to some extent, it may be helpful. But if you want to be successful, if you want to treat successfully, this Amsamsha Kalpana must be taken into consideration. And as I said, avastha must be taken into consideration. That's why avastham prapi nirdishtam kushtinam basti karmacha. I always love this slogan. So always avastha plays an important role. Vina tarkena ya siddhir yadricha siddhir avacha. So tarkam, yukti must be there whenever you are treating any disease, because basti is contraindicated in kushta. But if the avastha is demanding to give vasti, you must give. As simple as that. So COVID also, if you see how I managed, or with the help of other, like my internees. So we didn't we put the protocol as it is. You know, in the initial stages of COVID, we started with this Vasa Varakashaya. So where the Vasa leaves are collected and they are like, it is like, this Putapakaviti. Okay, the Vasa leaves are collected and they are heated, and the kashayam is made out of that Vasa and added by this Jeerakam. Okay, so this one is given in the initial stages of disease where there is problem with the difficulty in breathing, so where people were feeling much difficulties in like Urdhva Swasam kind of thing. So along with that, if there is any breathing difficulties, Pippali was given. Okay, so Pippali was given with the Kanakasavam and Vasarishtam. Kanakasavam, this is very good bronchodilator. Okay, and so initial stages, and along with that I was giving Vettumaran Gulika. Okay, Vettumaran Gulika. Okay, so if anybody has this fever, and this combination was given, and if the person, they have too much cough, here you see this Aushadha Kalam plays a very important role. So Pranavaha Srota Vikaras, Swasakasam, it is Muhur Muhu. So if you are going to, Acharya is very, very clever, and we are very clear in, they guided us. How far we are using that guidelines will determine the outcome of the success of the treatment. So this Swasakasa Vigaras, Muhur Muhu plays a very important role. So basically when you are trying to give, because the typical COVID cough I call, repeated cough will be there. The cough will be very short in like, like that. So the short cough and repetitive. So if the person is simply, if you see some of the COVID patient, you would have now by now you should have you would have understand that, you would have understood that like what kind of cough they have. This repeated short cough I call. So basically what I used to give is, if it is with sputum, just to take out more sputum or dry up the sputum, I use Talisadi with Karpuradi. Okay, along with that, Abraka Basmam Shataputi and Rasa Sinduram, Shadguna Balijarita Rasa Sinduram, Shadgunam, Rasa Sinduram, Shadgunam, their Rasayana, as well as you see Abrakam, it is very good for Kafavata and Pranavaha Srota Vikara and Kafavata Swasam and Kasam, it is very good. So I add, if there is too much of dry cough, I use Abrakam Shataputi I used, along with that Shadguna Balijarita, Sadguna Rasasinduram. Then I added Sitofaladi Churna. Okay, so this is the mild variation I made. And of course, I was asking them to use this Kanakasam and Pippali. So if some cases of COVID, they will have diarrhea, okay, and stomach issue. So in that, along with that, Pippali, I used Pippali, Musta and Kodajam. Okay, Pippali, Musta and Kodajam is used 25 ml thrice daily. And if you see, some people came with this particular symptom of not good appetite and loss of taste. Okay, and loss of smell. So with not good appetite and loss of taste and smell, I add along with that Kanagasam and Vasarishtam, I added Amritaristam there. Okay, and Amritaristam. So if some people has constipation, I was just giving some simple Avipathikara Churna. Okay, some people came with difficulty in like they used to have severe tiredness. So especially the people, those who have secondary diseases like diabetes, COVID secondary to diabetes mellitus, severe tiredness was observed. One Mr. Ramesh was there. So I gave him Shilajitu. Okay, pure Shilajitu, because it will take care of Madhumeha also, diabetes mellitus also. At the same time, it will take care of the tiredness. So the second day, he said, I'm feeling better. Okay, so I started adding Shilajitu with that. Okay, then when there is too much of bronchoconstriction was there, I used this Dashamula Kadatrayam Kashayam, Pippali and Kanaha. Along with that, I used Rasamanikya Rasam, because Rasamanikyam has Manashila, and which has the bronchodilator effect, though it is used in skin diseases, but since it has that, arsenic compound in that, I used it there in order to achieve. Along with that, of course, I used kasturi karup. It is a siddha preparation where it will work like steroid. Main is made out of kajali. Fantastic. Along with the rasamanika you give, like 125 mg, like 3 to 4 times a day. Or if you want to use it like a teaspoon or half teaspoon, add it with the sitopaladi. Immediate bronchodilating effect I could able to see in this combination. Okay. So along with that, of course, diet plays a very, very important role. Okay. So you see, that's why, if you see the Treva Upastambam, Aharam comes there. So definitely without Aharam and without Viharam, and one more thing before coming to that, the Viharam, I never allowed them to take bath. Okay, because the SpO2 levels can go down if they take bath. And I never told them to do much exercise. Okay. And one case like SpO2 level was, it went down to 89, 90, but we could able to bring the SpO2 level nicely up to 93, 94 with this simple combination. So these two viharas and simple, we were giving like this mangdal, kichirar mangdal kanji, the porridge made out of mung bean, or the mudga yusham was given. Okay, so I use it extensively, people, and in the post-COVID management, I'm just trying to use this Siddhamagaradvajam. Okay, and once again, this because this rasa sinduram is once again rasa vajigarnam and rasayanam. So I'm using that. Along with that, the 6th day or 7th day, because I stopped using vasa because some people because the blood clots are happening in the post-COVID patients. So I stopped using vasa there because vasa is usually in rakta pitta or rakta stampaka. So I don't know whether vasa can really create a blood clot, because Ayurveda never think in those lines. But still, since I don't want to take risks, so I was stopping vasa after some times, especially in the post-COVID management, where I was going with more rasayana. Okay, like kantakarya avaleham. Depends on, once again, the cough is there, means kantakarya avaleham or adadodai manapaha or vasa avaleham, or like siddhamagaradvajam. Okay, or this rasa sinduram. Okay, so depends on, or shilajitu, rasayanam, such kind of things have been used in our treatment. So, these are the simple treatments. It depends on the, avastha we could able to use. And you can see, even if you, like there are live patients. Yesterday, one patient was having severe cough. Today is the 2nd day. The cough is completely vanished. Okay, just with these simple medications. So as Dr. Vinod Vinod sir said, if government can allow, and so one of my friend, is practicing, if the O2 levels are going down, he's just putting, the onion, the small onions, crushed and putting in the ice. So immediately in the O2 levels are increasing. So we need to do lots of research on these things. And now I am planning to do one prayoga, if I'm getting any cases where the SpO2 levels are below 87 or 88, as per protocol, we should not admit. That's why I'm not admitting. But if anybody are willing, there is one prayoga in local areas they are doing, where, this calotropis, calotropis flower, the white one. Okay, the calotropis indica, the flower, the white one, like 3 flowers. You should take the internal flower and 5, these pepper balls, black pepper balls, should be given to the patient, and we must ask them to chew and take. And literally, I've seen some of the local vaidyas, they are doing it. The SpO2 is just like that, increasing within like minutes. So like people are going, and because many people don't want to check, or many people don't want to do, though we try to educate them. But the one vaidya is that he's doing that. So if anybody comes, I'm planning maybe like after testing it with after their consent, maybe we can, I'm planning, I can give and try, to improve the SpO2 levels. So like, as I said, basically, I think Dr. Somit is already waiting. Just, this 10 minutes talk I wanted to give, where, with this simple, or with this remedies, I thought I will share, as I said, Tadvidya Sampasha is always Buddhivardhakam. So this is what I used here to treat to manage the mild to moderate and even severe respiratory distress COVID cases. So I thank one and all for patiently listening to my talk. And if you have any questions, I welcome you. Welcome. Okay. Thank you. Thank you very much.
Thank you so much, sir, for the informative session. And now let us head right into the next session of the day on the topic Extension of Ayurveda and Advanced Investigation on COVID-19 by Dr. Somit Kumar. Dr. Somit Kumar completed his postgraduate degree in Dravya Guna and is currently pursuing his doctoral research in the Department of Molecular Biology at the University of Latvia. Dr. Somit Kumar has been an active clinician for past 13 years and specializes in Kerala-based Panchakarma technique. He has been invited across the globe to give presentations at international seminars, academic lectures, and for consultations, namely in Malaysia, Singapore, Brazil, etc. He is a core faculty member of AVP Training Academy. He is also involved in researches in the field of a rare genetic disorder, Duchenne muscular dystrophy, and working as co-investigator in this project with the University of Milan and Ayush. Sir is currently the Research Director, AVP Research Foundation, Coimbatore, and CEO, AVP Baltics, a European venture of AVP, India. He is also associated in the capacity of university lecturer and research scholar at the University of Latvia. With great honor, let me invite Sir to this platform. I'd like to hand over the session to Sir. Over to you, Sir.
Thank you so much. And indeed, I would be very grateful to Dr. Chandramouli, Principal of Ayurveda College, Coimbatore, and all the organizers and RVS institutions. So today, what I'm going to share with you is pure kind of an attempt to share a evidence-based practice of Ayurveda in mild cases of COVID. And also I would give you certain insights into how we are also venturing into integrative care. So at the outset, I would say that both the intervention or both the studies which insights I will be sharing are integrative care, where Ayurveda and allopathy has worked together, because both these researches have been done under the guidelines of Government of India, funded by Ayush, the first project, and the second project is funded by crowdfunded on AVP. Now, so today my topic was that extent of Ayurveda in its advanced investigation in COVID-19. And I would like to first thank at the outset, see, whatever I going to share with you is not one man's job, but the team who has been working relentlessly for last 1.5 years, whether in Stanley Medical College or in PSG Medical College. And some of you are among those faces, like Dr. Manigandan, who is I'm very proud to say that, see, I'm able to work with young budding doctors from your Ayurveda college who are ready to take the challenge and work in wards with the patient, taking care of them. And I think I should name them, and because whatever I'm sharing is their contribution, I'm just the spokesperson. So I would like to name Dr. Manigandan, Dr. Meera, Dr. Dikshaya, and also Dr. Sharanya. So who had been, who is your existing college student, and I'm very proud of them that they have been working relentlessly for last 5 months in PSG. Now, what I'm going to talk to you about. So first, I need to understand and make you clear as to what is the background of the study I'm talking to you. See, why should somebody opt for Ayurveda? This is a biggest question. So what kind of patients should come to Ayurveda, or what Ayurveda can do in COVID? So these are some questions. Whenever we try to build evidence, many a times we end up building evidence in a condition where the argument ultimately lies is, okay, whether you would have treated or not treated, it would have anyhow improved. So it's called as self-limiting disease. So you have to be very careful that in COVID also, There are conditions, there are mild cases there with no comorbidities, which may be self-limiting. So if we are trying to build evidence, of course, for public health purpose, we need to also do large scale preventive study, as Dr. Geeta Krishnan was already sharing with you. But our focus was very specific, that can we make evidence in the field where COVID may not be or is not self-limiting, where COVID does have a very strong threat to a person's well-being and can get into a severe COVID condition. With this, I would like to draw your attention to one of the famous trials done in the United Kingdom, which called as recovery trials. So I would like to mention a finding of that recovery trial, and on the screen you may be seeing that they found that people who came to hospital, or rather they were hospitalized because it required hospitalization. So first thing is, if a patient requires hospitalization, and if they are not on oxygen, what they found, they used different methodologies of intervention, including dexamethasone. And since dexamethasone is one of the frontline medicine right now for hypoxia, which ultimately also becomes fatal in severe cases, leading to, because of the outcome of acute respiratory distress syndrome in around 4% people suffering from COVID, it leads to death. So what this study said or found out is, if you give early corticosteroids or these steroids, or if you give to a patient who's not on oxygen, it is not going to change the mortality. That means death rate is not impacted. So whether you give dexamethasone or not, mortality will be the same, death rate will be same. So what is this? This is an opportunity for Ayurveda, that can we do something for people who are hospitalized, not on oxygen, but still require some active intervention? Can Ayurveda do something? So what we took the challenge was that we wanted to choose a high risk group patient, where suddenly or certainly, according to the law of the country, they need essential hospitalization, and diabetes or type 2 diabetes was one of the low hanging fruit. And we chose as essentially all the patients who are diabetic and was hospitalized due to COVID-19 in mild diseases condition, we started treating in integration with allopathic medicine. So what we did was, we created two arms, randomly asking patients to consent for each arm, and based on their choice, we put them into a one arm where only allopathic drugs were given, be it evermectin, be it azithromycin, corticosteroids, or remdesivir. The other group, we chose only those patients who consented to take ivermectin or azithromycin, that means antibiotics, but who were not on steroids or remdesivir or other IL-6 modulation drug. That is, it may be tocilizumab or other disease-modifying agent. So what we did was, we, from the baseline, that is the day 0, started treating them prospectively. That means for next 14 days, we gave an integrative therapy, and we tried to monitor various parameters, which either tries to study the efficacy of Ayurvedic drug or safety and interaction of Ayurvedic drug with the existing modern therapy, which is the standard therapy suggested by ICMR guidelines on 27th May 2020. This was our first study. Now, why this is important? Because we know of late that remdesivir does reduce the hospital stay, but it does not reduce the mortality rate. So we have to reduce even death rate for mild patients who later in course becomes moderate or severe. So you all know that COVID is a very fast progressive disorder, though progressive and also communicable disorder. So can we modulate the progression? That means, can we prevent the milder cases getting to moderate or severe to reduce the mortality? And second thing is that too in a high risk group, that is type 2 diabetes, which is a high risk group. It's not a low risk group. And then what we were looking for, so Dr. Geeta Krishnan was talking about a very important concept, which is called as host immune response. So what is this? I will try to explain you a little deeper later in my presentation. But what is very important outcome of our study, what we got was that, see, in modern intervention, you may reduce inflammation by corticosteroid, but you end up increasing the viral load. Now, if you give remdesivir, which reduces viral load, that too in first 5 or 7 days where NLR ratios are high, there it works, but later, once the hypoxia sets in, it does not help. So what is the gap in the existing therapies? You don't have a strategy, a convincing strategy in this mild cases where you can address to the viral load as well as the host inflammatory response. So can we do it together? So this was one of the major outcome of our research, is that with Ayurveda intervention, with customized Ayurveda intervention, you can address both at the same time, simultaneously. So this is a very important understanding which we have got from the data analysis. And whatever I have been sharing with you is not just mere a figment of our imagination, but based on proper statistical data, which are significant through a rigor of statistical methods. Now, let us first understand the broad chronology of COVID patients. So first 7 days is the most easiest phase and the most important phase in COVID patient. If any mild COVID case who is just symptomatic and he ignores those symptoms and do not do something from the day of onset of symptom, they land up in moderate or severe case. And especially if you are a high-risk patient, diabetic, hypertensive, history of cancer, autoimmune disease, and plethora of other risk factors, you need to be doubly careful. Now, this is a very important message which we as doctors need to spread is, please start addressing to the symptoms of COVID right from the day 0 when you have symptoms, not RT-PCR positive, but COVID-related symptoms. Later, you may become positive or negative. That doesn't matter, because we have been seeing a lot of cases where, you know, RT-PCR may be negative, but still you do a CT chest and other a biochemical and immunological profile which says that it is probably COVID. So be careful. If you are symptomatic, address to the symptom and take a proper course of action in advice of your Ayurvedic or allopathic physician or whomever you want. Now, if you don't do this, then you land up on an average on 7th day, people get hospitalized. And then if this patient goes to a severe course of disease activity, that means from mild, moderate to severe, it happens within a span of 2-3 days. That means by 7th, you may get admitted. By 11th day, you may be in ICU. Now, why? Because this is called as inflammatory cytokine storm we are talking about. Now, very interestingly, if you look at these whole 2 phases, the viral phase of COVID and host inflammatory response of COVID, it exactly kind of coincides with Amajwara Kala and Pachimana Jwara Kala or Jeerna Jwara Kala. Now, the first 7 days, which in COVID is viral phase, very coincidentally also leads to Amajwara phase of, suppose if there was a Jwara Lakshana. Now, many of us will say that, oh, we are also getting people who had just 1 day of fever, and then either he took paracetamol or other antipyretic, or they started Kapasura Kudirir or some Ayurvedic herb, the Smulkadutram, Indukantam and all, it got suppressed. But yes, it started. Or any other symptom which are mild in nature generally starts in the first 7 days, maybe with cough, diarrhea, headache, this common symptoms. You need to address this from a Gunakarma Vikalpam of Ayurveda treatment of Amajara, and we had our own algorithm which we followed, which we later will discuss. But whatever your Ayurvedic strategy of treating Amajara phase would be. Now, in Amajara, generally, you don't immediately get Sannipatika Lakshanas. So first, you may get Ekadoshaja Lakshana, Dvidosha Dvandaja, or Sannipatika sometimes when, now, generally we have found out Sannipatika Lakshanas only when they come on 5th or 6th day of their symptoms. So the first day it may be Dvidoshaja or Ekadosha. So addressed from that perspective of your therapy protocol, what you want to address, but what to look in your blood profiles. So what happens is many a times when we get these symptoms, we get panicked, and immediately we do a host of tests. We do D-dimer, we do all the CBC, ESR, CRP, and CT scan in the first week itself. And this is where many a time we overburden our finance and we don't utilize our viveka or discretion. Now see, in the first phase, it is viral replication which is more predominant, not the host inflammatory response. So you end up doing CT scan in the first 5 days, maybe 2 or 3 or 5, and you be very happy. Oh, I have a very mild grade, because more than 8 CT score is only going to be harmful for me, but never. See, if you look at the ICMR guidelines of staging of the COVID, they are basically clinical guidelines. They are not markers or biochemical test or CT scores. The simple method is, first you will have to look at SpO2 level. So less than 94, more than 94, the respiratory rate, just respiratory rate. See, many of us don't see respiratory rate. This is one, or it is says either SpO2 level or respiratory rate more or less than 24. If these are two criterias, then it is mild. When it is more than 24 but less than 30, and it is more than less than 94 but more than 90 oxygen saturation, this is a moderate, and beyond this is a severe disease. So basically the alarm bells should ring when you are crossing this mild criteria of either oxygen saturation or your respiratory rate. And that is where you need to see that whether it is falling on 7th, 6th, 7th or 8th day. If it is falling, it's a high time for you to either get hospitalized or get a very good advice from a good doctor whether you require oxygen support or other intervention. So as Ayurveda doctor, when we are treating a lot of home-based COVID, in milder case, we have to give the correct evaluation. So in first 7 days, if we are evaluating, please only see CBC, complete blood count, and see whether lymphocytes are going down, neutrophils are going high. If it is going higher and higher, that means neutrophils high and lymphocyte going down, that means disease is becoming little worse. That is NLR ratio becoming high. But if it is not, then probably the viral load is not increasing too much because the response to the viral load. Then another important thing, if you feel in first phase also D-dimer spike happens, but we are doing a 60 days follow-up study in COVID. What we are looking at, very interestingly, what we are seeing is D-dimer has 2-phased peak in COVID. The first week also it peaks, but then when the intensive intervention by aspirin, anticoagulants and everything happens, it goes down in the second phase, or that means after 7th to 14th or 28th day, 21st day, it comes down. But then when you are off this intensive intervention, again, D-dimer tends to go high. Now, why I'm trying to do is, we are doing a very good follow up with our students in our partner institution. This is a trend. So Dr. Geeta Krishnan was talking about long COVID complications, be it the endothelial dysfunction. Like we talk about that, the endothelial inflammation leads to a lot of coagulopathies and a lot of problems with cardiovascular events. Like we are seeing a lot of even events that you recover from COVID, but ultimately die of a heart attack, maybe because of the clotting or deep vein thrombosis. Why these all are happening? Because of coagulopathy. And one of the markers which you will have to keep monitoring even after 21st day or 28th day of COVID, because you know, the research which I was noting to you was only it followed up patients up to 28-day survival. So whether they survived up to 28 days, what happened after 28 days, nobody knows. So that's why we are working. What is happening to COVID patients when they are not on Ayurveda or only on allopathy? Till 60 days, we are trying to find. And what we are seeing is there is a surge, second surge of D-dimer. There is second surge of HS troponin. I talked to you about that. Why? So your strategy post the recovery should be very much precise to look at even the inflammatory changes which continues. So when we say jwara never ends. It's right from the birth to death, or rather aging itself is a process of chronic inflammation, and jwara continues. Here there is a strong surge. It creates, now why does then it create so much of devastation? So you need to understand that when jwara becomes jirna and pachyamana, then it is susadhya. But the same jwara, when it becomes vishama and dhatu gata and the dhatu paka happens, then ojas chaya happens, and then death happens. And that leads to, you may call it septicemia, multi-organ failure, and then finally. So what you need to understand is, this is decided on the 7th to 8th day of your management of jwara. So if you do not manage ama phase of the jwara in COVID properly, if you're unluckily your patient is in a very high risk group, you may get dhatu paka lakshanas, dhatu gata jwara, vishama jwara, and then leading to death. So this is a very important thing which you'll have to understand. Then how should we analyze people between 7 to 14 days? Now, 7th day is a 6, 7, 8 day. Please do have, if you have a facility for IL-6, do a interleukin 6 analysis or CRP inverse in case wherever is available. And also LDH, lactose dehydrogenase, which basically talks about what is the intensity of the inflammation kind of affecting your lung tissues. So what we are seeing is, if there's a good setup where IL-6 can be done, see a home-based patient IL-6, sometimes you will get false alarms because these is a very sensitive marker where during the transfer of these samples from home to lab, because of the temperature difference, they don't keep in ice box and all, it gets denatured, infiltrated by lymphocytes, and then you get false high alarm. So better CRP if it is a home-based patient. Now, do this only when patients are symptomatic from 7th day onwards. And then you can talk about if people having hypoxia, breathing difficulty, if you want to be very certain, high risk group they are, then do a CT scan. Otherwise, before that, it's waste of time. Now, what happens in the first 7 days? As I told you, the virus enters, and that is where today, ICE protocol talks about when transcription and replication of virus is kind of, can be first phase. So whenever you use Glirezia, Madhu Yashti, we are talking about Madhu Yashti, gargling. But in, in diabetics, we couldn't give those. So we just allowed them to gargle. And so as long as the virus in upper respiratory tract, it helps. But when it gets into the lower respiratory tract, then we have to give internal medicine to help those patients rather than just the local therapy. So nasya and gargling does help in the first 7 days of. Beyond first 7 days, once the virus enters into your lungs, there you can't do anything. There a systemic internal medicine would only help. There nasya will not help there. Now what happens when the virus gets into the lung? So the epithelial basement membrane or cells of the type 1 or type 2 cells of the alveolus gets infiltrated by these viral proteins, and then the war between your innate immune response. So we are talking about host response. What is this host response? The host response is this, your inherent capacity of your body to fight anything which creates disease. And here is the case is virus. So a virus protein is fought against by basically few warriors. So you have neutrophils, you have lymphocytes, and you have monocytes. Now, these are three warriors of your body, which is part of a WBC, that is white blood cell differential count. When you do white blood cells, so you have total count of white blood cells, and then you will have differential count where you will try to know neutrophil is high or lymphocytes are high or monocytes. In a typical COVID viral fever, you see neutrophil is going higher than normal and lymphocytes coming less than normal. And monocytes depends on what are you doing, because monocytes are very unique cells. Now, why I would tell you, because it is both pro-inflammatory. It says either it is a friend also in later phase of the disease. That means once the inflammation becomes little old, then M2 macrophages from monocytes generates. So if you go into deep molecular biology, you will understand that these monocytes are activated as macrophages when there is a strong inflammation. And then in an acute inflammation, M1 type of monocytes get or macrophages get activated. And in chronic inflammation, where the healing is taking place, M2 happens. Now, why this is important? I was so surprised by the data which we got from our clinical, though it's very basic, but gives a host range of opportunities to understand as to how complex and how beautiful is the way the Ayurvedic intervention works. Now, what we did was we approached 68 patients. Out of them, almost 49 patients agreed, and then we could finish for 48 patients, sorry, almost 28 plus 29. So some 55 patients agreed, and then we started them on intervention, and finally we could get 48 patients who could complete both the studies. And if you look at both the group were having a comparable uncontrolled diabetes. The Ayurveda group had HbA1c average 10.23, and the control group, the allopathic group, had 9.44. So there's no statistical difference between them. If you look at, again, age group, did we choose very young people? No, we chose almost an average age of our patient size in both group was 54 and 56, comparable, statistically insignificant difference between them. Now, we tried to first understand, can we reduce the hospital stay? But unfortunately, we couldn't get the data well, because see, when you have a pandemic, every hospital is seeing that how less amount of time people can be kept in hospital, and then they were sent to COVID care center. So we failed to get exact data in that. But what we got was that how many days on average is required if you are only on allopathy, and then when you take Ayurveda, is it going to reduce your duration of being swab negative? So what we saw, that average swab negativity date or median days were 9 days. Like if you would have been only on allopathy, you would have taken 9 days after starting of the therapy to become RT-PCR negative. But in Ayurveda integration, it reduced by 1 day. On 8th day itself, you can become negative. Now, this is not a big difference, but even 1 day of healthcare cost and opportunity is a good improvement. Now, these are something very populist, but then let us come exactly to understand what is happening. So as I told you, so when the virus enters, there is an immunological war going on. So when this neutrophil increases and macrophages from the monocyte starts attacking these viral proteins and cellular debris, it secretes what? An enzyme or a cytokine, which is called as IL-6. And that's what we are seeing. That means it starts happening on 6th or 7th day when people are going into moderate or severe condition. So if that war starts because of hyperinflammation, because generally your body is programmed for a proportionate response, but when there's a disproportionate response, IL-6 goes high, and generally it goes higher more than 2.5 times. And we were seeing that, is this happening? So what we saw in both the group, there was a increase in the levels of equal, like if you see the mean 16.47 and in the allopathic group for 15.18 baseline, it's statistically same. There's no difference in baseline. That means both of them are starting from the same level. And then when we started intervening for next 14 days, what we saw that interleukin IL-6 got statistically at 95% confidence interval, it got statistically modulated, reduced statistically from median value of 7.75 to 3.75. Whereas in allopathic group, where Ayurveda was not part of an intervention, 6.85 was there. That means there was no statistical significance. Now, why this is important? You will say, oh, 7 days earlier you modulated, what is the big deal? Now, this is the big deal, because the 7th day is the day, or first 1 week of being symptomatic is the time where you have a window to modulate a disease, to work on disease so that it does not go to moderate or severe disease. So and that too on a marker, interleukin marker, which creates acute respiratory distress syndrome, the accumulation of fluid in the lungs. And if you look at on the 15th day, of course, 15th day also the standard group created a statistically significant modulation. But what is important is the timeline. The 7th day, within 7 days, if you are able to modulate, means you are doing able to save. Now, why I say that it is making a difference, I'll again talk to you about, where we see that early viral clearance, less number of days of medication, almost 15% people in Ayurveda group became virus negative earlier. And then I will show you how the other modulation also happened. Now, if you look at second parameter of C-reactive protein, so both the group only responded in the 14th day. But what was interesting to note, that if you take 99% confidence interval, we say 95% confidence interval and 99% confidence interval, which is more difficult to achieve, Ayurveda group achieved that confidence interval. That means if you say on to our 14th day in CRP, whether Ayurveda group add-on did well or allopathy, then Ayurveda did better. So just to understand that both in IL-6 and CRP, relatively Ayurveda did a better job. Now, second thing I was telling you, that this whole interplay of IL-6 and C-reactive. Now, you have to understand C-reactive protein is not locally produced in the lungs. It is produced in the liver. So it takes some time to respond and time to become higher. But if you want to immediately see, IL-6 is the immediate parameter. Now, IL-6, as I told you, is basically secreted from where? Neutrophils here, and then from monocytes. Now, what we saw very interestingly, that allopathic group, there was a statistically significant increase in number of WBC. That means WBC is a defense mechanism, and there is a hyperinflammation. That means WBC will increase beyond control. So when you see it statistically, Ayurveda group did not allow, the statistic is 0.391. That means, and 0.24. There was no statistical increase in the WBC. Means, now you'll say, oh, is it good or bad? It is good in COVID condition, in hyperinflammatory phase. In first, when the storm is building up, you stop the storm from building up. But in allopathic group, the storm had more build up, though it may not create a death, but one patient went to ICU, yes. But this buildup of storm was somehow modulated. Now, this is statistically significant, that WBC. Now, WBC is composed of, again, I told you, neutrophil, lymphocytes, and monocytes. Now, in generally in COVID, neutrophil should increase. So anything which reduces neutrophil is a success of therapy. So if you look at, though it was not statistically significant, but still if you look at the whole trend from average 61, it reduced to 57.8. Now, when I say 61, that means in real terms, it is almost thousands. So 600,000 into 10 into raised to power 3. That means it's millions of cell which has decreased. That means if neutrophil is reducing, and then what it is doing, Ayurveda group, lymphocytes are increasing 29 to 32. That means it isn't, though it is still not statistically significant because of standard deviation, but we calculated the study. If we would have 243 patients, we took only 48 patients, but if you would have, we would have taken 243 patients, the same trend would have become statistically significant. That too between both the groups. That means around 120 patients in Ayurveda group and 120 patients in allopathy group. So we would have got statistically significant the same data. Now, what was unique was monocytes. Now see, I was telling you monocytes has two-prong attack. That means the first phase, if you're looking in monocytes in both group, the monocytes have reduced in first 7 days. Now, why? Because when you are doing immunomodulation, first your monocyte activity will respond, because if it is also hyper, then what will happen? Your IL-6 or storm will increase. That's why whether monocyte is friend or foe, very nice article is there. Please go and refer. I'll show you that. But what is uniquely happening in Ayurveda, in allopathy group only, it keeps on decreasing. That means monocyte keeps on separating because you have immunosuppressant drug, keeps on suppressing. Now, why this is not good? Because you didn't allow M2 monocytes to increase. But in Ayurveda group, again, in the second week increases. Why? Because in second week, when M2 macrophages are increasing, it will be anti-inflammatory. First week, acute M1. Now, this is not my figment of imagination. There are a lot of studies already published which talks about total WBC, neutrophil count, IL-6 increases, worsening of COVID. If lymphocyte decreases, less of it's a worse outcome. Now, go through this article which is already published in Elsevier, monocyte and macrophages, friend or foe. This is an excellent article which will give you an insight as to how this interplay, and which is very uniquely seen in Ayurvedic therapy. See, this is what is an advantage of customized Ayurveda therapy. You cannot create this results with very standard protocol. You need to have this customization where you see a Pitta Lakshana, you may change your Kashayam. When you see a Kapha Lakshana or Tridosha Lakshana, you can respond. And we just documented the way we were practicing. We were not giving this, because many a time all these results came after we had changed the medicine just based on the symptomatologies. But what a excellent. Now, I was telling you macrophages, how acute phase it modulates the IL-6. Now, neutrophils both modulate. So what we are seeing from this data, that since WBC is not increasing significantly in Ayurveda group, and there is a reduction in neutrophil, increase in lymphocytes, and modulation of macrophages, this is what is unique kind of immunological response we can create. It's just like a story what we create through Ayurveda therapy. Now, this also is not unknown in heart attack. So when you have acute first day of your heart attack, M1 macrophages increases. And in latter phase of resolution, M2 macrophages happen. So this is also very true. That's why, if you are modulating M2 macrophages, or you are doing a surge of M2 macrophage in the latter part of the therapy, where your therapy, the monocytes again increases or come back to normal, it is very important. And that happens with Ayurveda therapy, which prevents from also cardiovascular complication. Third important thing is it safe? So how did it interact with allopathic medication when we gave along with, and basically allopathic medicine along with Ayurveda was ivermectin and azithromycin with a battery of vitamins now and zinc. Now, if you look at, you see a very unique thing, total protein becomes statistically changed. Now, total protein, especially in pediatric cases, I was going through a lot of literature now, which will be very important for the next way people are telling. In pediatric cases, if you are increasing, so why is important? Because basically total protein in COVID goes down, or it does not change much. But in Ayurvedic therapy, during this acute inflammation, it is increasing. That means it is very important sign. It's according to literature, it shows that first you are able to reduce the severity of the disease, and second thing is also we are seeing that many inflammatory changes also in pediatric case shows a reduction in albumin total protein levels, and there is also a ratio between albumin and the other globulin ratio, which is very important. And since globulin ratio is ratio is very high in pediatric cases, that's why they are not getting very kind of strong COVID. There is some research. So this is an interesting data. Very recently we could note. So we are still going deeper into understanding this in terms of pediatric COVID management, whether how this same protocol can also help us manage pediatric COVID cases in future. Now, second thing is coagulopathy. Now, what from our data we saw is D-dimer and prothrombin time, they are two coagulative markers. They are not a big problem in mild cases, but I will share with you the next project which we are doing on long-term follow-up COVID cases. We are seeing that really matters. So in acute phase, mild cases, of course, we see both group having equal response, but in when we have come to moderate and severe cases, the story is totally different. Second, again, important parameter is an add-on Ayurveda therapy good for renal profile. So what we found out, yes, it's very important to see that we got statistical reduction in creatinine level on 7th day itself. Of course, in standard group also there was change, but on 14th day. But what we are looking at is somehow we were all talking, Dr. Kirta Krishna was also talking about integrative protocol. So integrative protocol can work together, and we find out that it is reasonably safe and efficacious. Now, what we used, they are Indukantam, Bharangyadi, Drakshadi, Pandachaktikam, Guduchyadi, Ashtanga, Churnam, Vilvadi, Swarnamuktadi, Praval Bhasmam, Gorochanadi, and so Swasanandam Gulika, and some cases kind of Lekhyas, Lakasta Rasayanam, Dashmul Rasayanam, all this. So basically we have not used very high-end Rasaushadhas. Of course, in moderate and severe, we have started using it. But see, again, you have to understand that our protocol was very restricted with the number of medicine, because ethics committee had to priorly approved, and we got only approval for very short. So whatever efficacy we are showing you with a very small set of medicine. So that's, just imagine if we are allowed to do everything, whatever we want, we can do much better. Now, people asked, are there adverse events? Yes, if there is an effect, there will be a side effect. So what we saw is basically the Pitta Vriddhi Lakshanas we saw, because generally when we start giving muhurmuhu chikitsa with Ushna Aushadha, people develop some mild gastric irritation, body heat, throat irritation after taking food, taking this medicine. Apart from that, we didn't find any long-term severe side effects. So you need to, and rather I consider these adverse events as a very nice signal to do change in your prescription. So avastha has been changing. So maybe you are trying to increase too much, in trying to increase Agni because you are trying to treat Ama, you started doing so much of Agneya therapy. So then you have to start going for a Pittahara Chikitsa. So we in fact, many a times this adverse event helps us. Yes, of course, you should not end up killing a patient in that way. But still, what we see is they were very mild. But in allopathic group, we had two adverse events, which was a little moderate. One was constant high blood pressure, required some kind of intensive monitoring, and then one case of trachepnea for which the patient was admitted in ICU. Now, later we tried to continue this. So this was what we developed, a kind of a very balanced approach to understanding what Ayurveda can do for a mild and moderate, mild cases. So what we took next step was for moderate and severe cases, and yet we are doing this study. So I would just like to show you two cases. One case which is receiving only standalone allopathy, but see, please don't take it as important data, but I'm just showing what should we look in for people who are either moderate to severe, and when we are doing long-term follow-up. When you see these two cases, age match control, so control group 67, Ayurveda group 66, both almost on room air 87, room air 90. Baseline CORAD score, again, as I told you, only believe this CORAD score if it is on the second week, from 7th day to 10th day, if they have taken, is good, or 7th day to 14th day. So it is 16 or 15, both. And after 2 months, see, we don't know right now. It is a very open question as to what is the minimum time is required for an integrative therapy or allopathic therapy to reverse the lung kind of changes, these brown ground glass opacities, or whether we can prevent fibrosis. So it's we didn't know what it is. So we have kept right now 60 days cutoff. What interestingly we will find out is people generally below 10 CORADs baseline, they reverse, but above 10, we need longer time. So we have asked permission to go it for longer follow-up. So we are following up beyond 60 days also. So in such cases, what we will have to look for. So I was telling you, don't be happy if the D-dimer is controlled between first 14 days. Now, what I'm trying to show you, we do a D-dimer analysis from 14th day of the therapy, because thereafter this cardiac inflammation or endothelial dysfunction and coagulopathy again reoccurs after acute phase. Now see, people who were in add-on Ayurveda therapy starts with a little lower baseline. Only allopathy starts with higher baseline. Now see, by 28th day, they both increase, but if you continue giving them proper Rasayana Chikitsa or Jirna Jwara Chikitsa, Ghrita Prayoga, Lekhyas, you should give Brahmana, but not Amakara, Deepana Pachana, but yet Brahmana. You can do whatever Prayoga you want to do. What you see is this cardiac coagulopathy markers go down better than allopathic group. I'm just showing you one, but I have a group of almost now 13 cases in allopathic Ayurveda group and almost 6 cases. It shows the similar trend. So I don't want to right now preempt, but we are waiting for. Same is with HS troponin. Now this is again, if in your place you have an access to high sensitive HS troponin level, we see that Ayurveda, people who are on Ayurveda group generally starts with a lower level of 14th day troponin, and then they are fairly controlled. But in allopathic group, we are seeing a surge more than Ayurveda group. So if you are looking for long-term COVID management and proper documentation, please look at these 2 markers. Many of the labs will do HS troponin positive, negative. Please be very careful to say that we are not looking at that, but we are looking at a proper value-based HS troponin levels. Now, this is a case where CT does matter, where I told you less than 10 or 10 up to 10, we have seen that within 2 months, 2.5 months, it totally recovers. But this is from ground glass opacity. Again, please don't mistake. Ground glass opacity does not mean the patient had acute respiratory distress syndrome or pneumonia. Pneumonia and ground glass opacities are 2 different understanding. So here, this is because of the fight I showed you in the epithelial layer of alveoli. So that shows. But if there is also pneumonia, you have to be very careful. And we have improved our understanding and knowledge about this. And we have been using of late on those conditions, Punarnavadi Kashayam, which is very effective in Shopha, at the same time indicated in Kash Swasa. And also we are working with Rasonadi Kashayam, which is told in Vatadhika Hridrogam. Excellent, this combinations work excellent with such cases, and even in cases of lower SpO2 value. I just want to rush through. What we did was very pre-planned. So we didn't choose IL-6 and CRP all of a sudden that, okay, it may improve. So what we did was, why we chose only Bharangyadi Kashayam, why we chose only Panchatiktakam Kashayam. There was a proper understanding with the background literature research we did. And also in terms of understanding of Taruna Jara, where in Bhaishya Ratnavali, Panchatiktakam Kashayam. But this Panchatiktakam is different from what generally we use in Vatarakta. It is having Kantakari, Guduchi, Shunti, Pushkar Mula, Kiratatiktam. So this is told in Chakrata as well as Bhaishya Ratnavali Jwara Adhikaras. You can see this is an Ama Tikta Pachana, Ama Jwara. We do, and when it gets into Sannipatika, now you will say why we used only less number of, because that was what we were told to reduce as less as possible, because we are doing a kind of a clinical trial where customization is limited, but still we tried to fit into that. And Bharangyadi, Brihad Bharangyadi, again it has Pushkar Moolam, Bharangi, and all the Dashmula. Now, if you look at, Shunti has a lot of clinical and preclinical research on ARDS, and also modulation of IL-6. So it was, so I'm showing you this where they have already studied in ARDS, not because of COVID, but some other condition. It improved the outcome. They were on ventilators. It modulated IL-6. Ginger, simple ginger water can also do wonders. Guduchi, already it's been indicated or studied for IL-6 modulation, and also cytokine, anti-cytokine activity, and to anti-thrombolytic activity. That means coagulopathy, D-dimer. And so what we have seen is, the moment we see some blood clot issue, immediately we talk about Lasuna. Even I many times, but we fail to realize even Kantakari and this Guduchi is anti-thrombolytic, because there has to be. So of course, Vata, Kafaja, Lakshana, we can use Lashunam. But when it is Tridosaja, their Lasuna may not be correct, or too much Pittaja, it may not be possible. So Kantakari and Guduchi, I'll show you, there's a very nice research done by Shastra University some 2 years back. And I was surprised that these served as why to choose this combinations for. Endographis, TNF modulation, IL-6 modulation has been studied, Bharangi, excellent NO. See, if you see in when this war between the macrophages and neutrophils happening, there is free radical activity. Which free radical is basically in the lungs? NO. It is not other free radicals. They are NO activity. And Bharangi is specifically working on NO stabilization. Then Pushkar Moolam, it's very good for LDH. See, IL-6 modulation, LDH level. So already studied in preclinical. Musta, again, it is anti-viral, and it's also in molecular docking studies seems to have been working on the corona virus. Saliparni, Prishniparni, excellent, studied for LDH modulation, CPK, SGOT, SGPT modulation, even NO modulation, macrophagic modulation, Gokchura, IL-6 modulation. So what we have tried to see is Dashmula, anti-inflammatory, anti-platelet. Now, again, antithrombolytic activity, Solanum, xanthocarpon, anti-Dinoscova cordifolia. Already, see, this was very, see, what I'm trying to state is that this whole effort we tried to do in a organized way. That's why we had a lot of limitations. See, because of choice of drugs and all, we had to give all these, to ethics committee, show all this research, that preclinical, in vitro study, all this research to convince them to allow us to do. But then when we have done it, whatever we have got as an outcome is beautiful. What if we would have been allowed to do whatever we wanted, it would have been more beautiful than what we have got. So as practitioners, we just wanted to say that be pragmatic, apply your yukti. Ayurveda can definitely work with other system of medicine. So when we do standalone therapy only, we are serving, it is it's misconception. So mild cases, moderate cases, non-high risk patient, standalone Ayurveda definitely will do wonders, no doubts about it. Let's make more evidence on that. But even in kind of challenging situations, high risk patients, Ayurveda can integrate with modern medicine and other system of medicine to create a good outcome. So thank you, the organizers of this conference. And in fact, I wanted to tell Krishna Kumar ji was the soul of this project. And then we have lost him, of course. But I think every day we come to do something new in COVID. It's only because of his inspiration. So I would really seek his blessings and thanks for giving us this platform to do this research, and also all the organizers to share my views, and patient hearing for all the participants.
Thank you, sir. It was really wonderful listening to you. It was really an informative session. And now I open the session for discussion. And we request the participants to post their question in the chat box so it can be discussed. Okay, so we have a few questions from the chat box. Shall I read it out, sir?
Yeah, please.
Okay, sir. So lower respiratory involvement, that is Kaphasthana, Katurasa, stronger Pachanaushadha are appropriate.
We fail to recognize the Sushuta's sloka, which says that Pupusa is Rakta Fena Prasadaja. So we only talk about Urdhvanga and we feel Kapha. But structurally, see, in COVID, the structure of lungs is involved. The Pupusa is involved. And Sushuta says Rakta Fena Prasadaja. So if you eliminate Rakta Dhatu, which is also Paitika, you will do a mistake. And that's why when we were choosing Bharangyadi against Dashmula Katutrayam or just Indukantam, this thought process was behind it. And I see that that has yielded results. Okay. So so don't always see always. So I have utilized Sushruta in our practice based on this, where each structure, like, when we say vrika or kidney, it says Rakta Meda Prasada Jaha. So structurally, dhatu wise, I have to treat Rakta and Medo Dushti. So I have to use dhatu gata. Of course, dosha is important, but then which dhatu is involved behind it, you also have to treat. So in that case, please don't ignore the importance of Rakta in Puppusa Roga, whether it is COVID, whether interstitial lung disease, which ultimately created fibrosis, long-term inflammation, slow inflammation. In COVID, it happens all of a sudden. So don't ignore Rakta Dhatu. That's why Tikta Rasa is also important. But that is what we found in Bharangyadi, an ideal combination of Tikta Katu Rasa. And Anushna. See, again, important is Anushna, because Rakta, Dhatu, anything which will be, should be Anushna. Yeah.
Okay, sir. Thank you, sir. So, in COVID patients, post COVID symptoms or long COVID symptoms were also seen. So, how was Ayurveda group on that? Did they have them or not? Were they controlled in due time?
Yes, we are, as we have seen that many people do suffer from long COVID symptoms, especially what we are looking at is fatigue is one of the main COVID symptoms. Clinically, first, I want to tell you, uh, headaches, we have found out that it exists for a long time. We are also looking at breathlessness as one of them. And from markers like, biochemical markers, we are seeing that at some point of time, the D-dimer and troponin, that's why I have shown you, you have to control, otherwise coagulopathy and all these heart attacks, stroke, deep vein thrombosis, or idiopathic thrombocytic purpura. So COVID-induced purpura. That means when platelet comes down. See, I'm not against a particular product. I'll not name that product. It's becoming very famous. It has a papaya extract, and it is told that for mild COVID, everybody can take. Unfortunately, please be careful. If you already have high platelet count, which I have seen in my study, most of the patient whom I saw, the platelet count had gone up. If you would have seen my slides, if I still give papaya extract, platelet count will further go up. Now the issue is, so those medicines you should be very careful. Only when certain subcategory of COVID patient where there is low platelet count in their clinical evaluation or hematological CBC, then only you should use. Otherwise, you end up increasing more, and if there is more platelet count, sometimes thrombosis becomes more. So be careful with use of such a combination where there is a papaya extract.
Okay, sir. Thank you, sir. So, can we use Dashmula Kwat with steroids?
Yes, we have used the Bharangyadi Kashayam as the Shmulam. So why not? Yes, we have seen that it's compatible. I have even in severe. So in this case, we had only, in our group, there was no steroids, but the new study which we are doing for moderate and severe cases, we are using Bharangyadi Kashayam with steroids. For most of the patient, because here inclusion is everybody will be on remdesivir and steroids. Those cases only we are taking, and whose SpO2 and oxygen levels are less than 94. And CT score is more than 10. So we are taking serious cases. So till now we have not found out any big nephrotoxicity, and so that is under a study. So give us 2 more months time. We will be, and I really thank your college students. They are working in the wards faceless with PPE. That's why I wanted to show them you all their faces, because see, they are doing the hard work of treating these people with compassion, following up every day, taking blood count, and a marvelous job they are doing.
Okay, thank you, sir. Moving to the next question. Sir, as a preventive medicine to COVID, can you suggest medicines?
So preventive medicine, see, personally, this is my personal overview. So there is nothing 100% preventive. So you can adopt a specific dinacharya, ritucharya. Now, I always talk about, see, about dinacharya and ritucharya in also in prevention. Why? Because see, we all said that, okay, in summer season, since it is hot, COVID virus is unstable in heat, COVID cases will come down. But it happened the opposite. It still went up. Now, but Ayurvedically, if you see, the Bala is, in India, it started in spring. Okay. Bala is Madhyama. Continued in Grishma Ritu, Bala is Hina. Continued in rainy season, Bala is Hina. Continued in autumn season, Bala is Madhyama. But then reduced in winter season, Bala is Uttama. Now, see, if we are able to follow up, now, why I'm trying to tell you is, all the Ritucharya has been designed to address this Bala and Agni issue, isn't it? So if you follow appropriate Dinacharya according to Ritu Charya Niyama, food and lifestyle, plus Rasayana Aushadas, yes, you can keep on taking a lot of ginger tea, or so there are 2-3 herbs which we see. Amalaki has been told to not allow the ACE receptors in through which virus goes through. There is a docking study done. Ashwagandha, they all tend to compete and block these ACE receptors. So those things can be taken, but again, and also, of course, Ayush guidelines are there for prevention. But again, please don't expect that if you are following this, there will be 100% prevention. If that would have been true, we all have taken so much of, see, there's no sin in getting COVID. What is important is how did I manage the COVID? That is very important. And rather, getting a COVID is now a boon. The studies in Italy said the people who got last time naturally COVID, they have antibodies till 1 year, and only 0.43% of people got reinfection. Better than any vaccine. Now, what I'm trying to say is, go on Lancet. It's a Lancet article. I'm not just whimsically telling you. These are Lancet article just published last month. So 1 year follow-up they have done. So see, managing COVID is more important. Be careful, follow social distancing norm, everything. Even after that, if you have, there's nothing to lose. Manage it with a proper, appropriate protocol based on how you are guided by physicians.
Okay, sir. Thank you, sir. Sir, any cases treated with high HRCT values like 24/25?
22, up to 22 we have recorded, survived.
Okay, sir.
24, I have not any experience. Up to 25, 22 we have recorded in our study, yes. See, high HRCT, again, I told you, is not an indication of severity. See, high HRCT, you can have 24, but if there is no pleural effusion and there is no fluid in the lungs, nothing will happen. What do you have to see that if with high HRCT value, if there is a pneumonia, viral pneumonia, that is a problem. So HRCT value only corroborated with pneumonia and high NLR, high IL-6 and high LDH level is, so you don't just, HRCT before treatment 24, after treatment 0. Nothing we can prove.
Okay,
You
sir.
have to understand the whole. That's why I was trying to say that why that claudication or ground glass opacity happens. This is because the fight between your immunological cells and your viral protein, which creates some protein rich fluid. So still it has not become pneumonia. The moment pneumonia happens, it is the ARDS. And ARDS is a very, so you have to study how, properly note how many of your patients who were having severe COVID landed up with ARDS.
Okay, sir. Thank you, sir. Moving to the next question. So, what is the role of Prakriti and Ahara in your experience when you are treating COVID-19 patients?
Um, give me one more month to analyze the data. We have kind of, noted in our first study, we couldn't note the Prakriti properly. We were so overwhelmed with number of patients and a lot of other stress that we couldn't note the Prakriti. We were just doing a Vikriti analysis. But in our second study, we are doing a Prakriti analysis. So we can tell you a specific Prakriti which is getting severe disease. Right now, I will not be able to comment because then it will be just being populist. So let me get hard evidence to tell you the way I have told you with datas, what we can do. I can tell you, okay, if there was a trend. Again, importance is also sample size. With just 25 people, can we generalize? Again, I may not able to. So, but yes, we can show you the trend.
Okay, sir. Thank you, sir. So, dosage of Amrita Sattva in any condition.
Oh, see, we have giving Guduchiyadi Kashayam, you can give Amrita Sattva. Very good. But dosage, I would not be able to comment you right now because we don't use Amrita Sattva, but we use Guduchiyadi Kashayam, which is having Amrita, Guruchi Padmakarishta Dhanika Rakta Chandanaihi. So Pitta Sleshma Avastha we give. Especially, when you have Pitta Sleshma Avastha in intermediate phase, we get. Sometimes when it's highly inflammatory, we give that. Our dosage is we use concentrated kashayam 15 ml. So on an average 15 ml twice daily in some cases, which are mild cases to moderate cases, but in severe cases we can go even 4 times daily, 15 ml with 60 ml of lukewarm water.
Okay, sir. Thank you, sir. So, what dravyas work particularly to reduce LDH and D-dimer?
What dravyas? Dashmula works excellent, and in that you can make your Krishnaparni, Shaliparni. See, I've been using we do the Gunakarva Vikalpam based on dosha, but as a whole, Tridoshaja, Dashmulam is definitely helping to reduce LDH and D-dimer. Then again, you have other options is Rasona as one aspect, which is Vata Kafaja. And then if it is Tridoshaja and Vata Paitika, you have two other options, Guduchi and Kantakari. I think if you have these combinations in your thing, you can definitely improve upon this. I've been vehemently using it. And I'm getting very good. D-dimer from 3,000 or 8,000 coming back to normal. So like we have been, see D-dimer, what we saw is if it is not ICU ventilator based patient, it is not very good marker to prove your efficacy. Yes, if you are an ICU based patient, ventilator patient, then D-dimer is very good for acute phase. But for chronic phase, long-term follow-up, D-dimer is a very good marker now. What I'm seeing in based on my sample size of 36 patients for severe and moderate disease, what I'm following up.
Okay, sir. So, how to manage and prevent COVID in small children and in Garbhini? What about Swarna Prasha and other medicine?
Garbhini, I can't comment because I have not treated any Garbhini patients right now. Yes, I have given some Rasayana to prevent, like somebody is Garbhini, to give something for preventive. So I generally give Brahma Rasayanam and Agastya Rasayanam as kind of, preventive medicine for Garbhini. But not with COVID. Again, please make me clear. Okay. Now, second thing is for children. See, children, again, it is as why I was telling you that albumin thing, because there are a lot of papers coming up with child COVID conditions which they have evaluated, and there they have given very much important to albumin levels, because child becomes hypoproteinemic very fast. And that's why, protein energy malnutrition like Kwashiorkor and all are very high in children's. So what I see is I would not deviate from this protocol. I'll still stick to this protocol, but reduce the, of course, dosage according to the child dosage. And what we are doing in our, so 3 or 4 child patient through our friends we have treated, we add Dashmul Jirakadya Arishtam, because see, child also the problem is the taste. So we have seen a very important response is Nimbamritasavam, Dashmul Jirakadya Arishtam. Now again, see, please don't mistake me, I'm telling you the names, but see, it is, you are better judge of what to give, but I'm just narrating you what are our options we are using, and which gives a fair results. So and again, I'm not claiming, because still we can't do a clinical trial still on young children, because they are vulnerable subjects. So it is just out of a clinician's point of view. We and see, what I have seen is Swan Muktadi Gorochanadi is a Ramban, like, you know, it's a Brahmastra in COVID. Both are Rasaushadis. One has Swarna Bhasmam, one has other Bhasmas also. So both are Gorochanadi, which is Kerala based. So in Vasant Kusmakar in North and something like that. Vettumaran I have not used. We see without Vettumaran also we have managed kind of, you know, fever. But you know, because Sannipatika Jwara, basically Swan Muktadi and Gorochanadi has been told. And what are the complications like Sirashulam, Hridravatva, or stroke, and all these, or Ghrananasa, or this Nidranasa, they all are indicated in Swan Muktadi and Gorochanadi, not in Vettumaran. So what we are looking at is a long term. So Kashta Aushadha we use Jwara, and the Rasa Aushadas we use this for addressing those things. We have got excellent results from that.
Okay,
So
sir.
you have to make this combination based on the Kaumara.
Okay, sir. Thank you, sir.
And one Kushmanda Rasayanam is one another combination we have been giving to. I have some, like, you know, 3 adults of the same family got COVID positive, but children's did not. Even we tried, we tasted 2 or 3 times. We were giving the combination of this Kashayam and Kushmanda Lekiam.
Okay.
But again, we can't say that it happened because of the thing, but they were negative, still negative. Yeah.
Okay, sir. So we have Dr. Suryanarayan Patnaik with a question.
Sir, good evening, sir.
Good evening.
Sir, about third wave, we are all fearing about Delta mutation virus is spreading a lot all over the world.
Yeah.
So what is the protocol? The same protocol I have to maintain, or is there any upgraded things are there?
So we must have already treated a lot of Delta cases in our, see, unfortunately what happens is right now all medical college, we don't have, we have RT-PCR facility, but we can't do the sequencing. So we have been seeing a very unique CBC values. Now, since I'm seeing a lot of cases, so I know which is not the same variant as last. So what we have changed our strategy, that in the new wave, what we are looking at is a very strong inflammation happens suddenly. Shofa happens very fast. So that's why we have, when there is a very fast hypoxia happening and all. So that's where I told you Punarnavadi Kashayam has been added, which is again Shopahara and Swasakasahara, and also Nayopayam Kashayam, which is just 3 dravya, Bala, Shunti, and Jiraka. And then we have used another thing is Rasonadi Kashayam. So I think with this Delta variants, we have managed. See, in Delta variant, what we are seeing is NLR doesn't get affected very fast. I assume. See, I've not done it for sequencing, but this is what we are seeing this. So whatever variant, see, this is where I want to say, whatever the variant will be in COVID, we will have our doshic way to approach. And of course, our way of prescription has changed in second wave, but it is not that it has not responded. So let us not worry about Delta, Theta, or Gamma variant. There will be N number of variant of COVID. What is important is if we do a doshic basic analysis and do from this perspective of Sannipatika Jwara, Agantu Jwara, whatever, from Jwara perspective, if we address the thing, and Rajyakshma, yes. One important thing is also that you need to, post-COVID management has to be inspired from Rajyakshma Adhikar also. So we are using a specific Ghritam called as Baladi Ghritam, Rajyakshma Adhikara Charak Samhita. So there also we are taking inspirations to treat. So I think let's not worry about variant. We can treat any variant.
Okay, thank you, doctor. One more small doubt. Can you ask, doctor?
Yeah.
One more small, Doctor, dexamethasone, can we use in the first line of treatment? Can
No.
cause to drop the lymphocytes and it stops the natural activity of B lymphocytes and T lymphocytes. Can cause it good for the COVID?
No, I have seen many people getting in trouble. So that's why my opening remark was with that research which tells, please don't use dexamethasone in first phase. Unless and until patient is hypoxic, please don't use dexamethasone. Otherwise, it will increase the viral load. I am not telling, Lancet is telling. And that is the place you have to come with Ayurveda. And with Ayurvedic therapy, you can modulate inflammation as well as reduce viral load.
Okay, sir. Thank you, sir. So, considering the pathophysiology while treating COVID patients and published research papers, I feel Samprapti further causes Raktavrata Vata or Vadarakta. Does it make a sense to call it COVID-19 a vascular disease?
Yes, that's why we are doing HS troponin, which is a vascular marker, long-term slow inflammation in the endothelial. Yes, Vatarakta, yes. I think, see, it's from Jara to Vatarakta you can treat in COVID. See, you know, your friends working in COVID ward, they were telling one day, you know, we are missing a lot of cases outside, sir. We are only seeing COVID cases. I said, I will teach you one day how, if you have treated COVID, you can treat any disease in this world. Because fortunately, in COVID, what happens in span of 15 days, in our all general practice, we see under some in Jwara phase, some in Pandu stage, some in Shobha stage, some in Vatarakta. And you are seeing all these disease in wards in small time. So if you can manage, COVID, I think, see, that's why I don't know, some of you, one of my teacher, Dr. KP Muralidharan ji, he's a very nice teacher. What we all are is because of his acumen we got, and also Dr. KG Ravindran, I want to mention, who trained us. So see, they taught us, if you can treat Jwara, you can treat any disease in the world. And it is true. So it is very misconception that Jwara, that COVID is only, should be treated based on only Jwara, because in Jwara itself, you see the Kashayams in the first stage and the last stage, you have Kashayams from Jwara to Rakta Pitta to Apandu Shobha and Vatarakta. You go through Jwara Adhikara, everything is there. So I think when I tell Jwara is everything in this world, because most of the disease is inflammation. If you are able to manage inflammation or Jwara in Charaka perspective and in Sushuta perspective, Shobha, you are done. So this is what Trishophiya Adhyaya and Jwara in Ayurveda talking about.
Okay, sir. So, your experience on Panchatikta Kashayam?
Excellent. In Ama phase, excellent. So, but yes, you can't use Panchatiktakam when people are also in hypoxia. So when you have high NLR level and you want to prevent hypoxia in Ama phase where there has to be used Tiktapachana, you have to use Panchatiktakam. But
Okay.
if people already are showing now Vatika Lakshanam, Ruksha Guna, can I give Panchatiktakam? No, I have to go to next level. And that's where Drakshadi comes. See, many times I told you, most of the adverse event taught me to say that, oh, I've done more than what I should have done. So I used to give Vilvadi Gulika when the patients used to come with Atisara. So we used to give just half Vilvadi Gulika, but it's Ushna Tikshna. After 2-3 days, and since that time project was done in summer season, Grishma Ritu, Hina Bala, even with slight people having history of kind of, arches and uh, constipation, they had constipation. I showed you one of the side adverse event as constipation. Why? Because that means, see, enough of Vilvadi Gulika. Now I am fine, and my prakriti or my state of health doesn't want. So you have to go to Drakshadi. That you have to, but not that much Drakshadi that it will create too much of Anulomana. Then maybe Guduchyadi. So this is where, see, as a clinician, you have to do Guna Karma Vikalpam. So you see a symptom, you respond to it, and you have to, it's, see, I say Ayurveda, we play chess with the patient. So we make a move and your body makes a counter move. You need to win the game with an appropriate response. Not, okay, my sir was using that kashayam, so I will use only that kashayam. If it doesn't work, I don't know what to do next. So this is where it's called as Gunakar Magilpam. You are taught to play with kashayams. So when you start making these combinations, your friend, like a friend, where it will act, how much it will act. This is what a good physician should do.
Okay, sir. So post-COVID protocol and when to start Rasayana.
Yes, so when Ama Lakshana is over, generally I have been seeing that in severe cases, in mild cases, after 14th day you can start, or even after 10 days you can start. Once the Ama Lakshana Kapha symptoms goes down, Dipta Agni happens. See, many a times Atyagni happens in COVID. You will see many of your recovered COVID patients say, I am so hungry, I feel like eating. Atyagni is there, in fact. Now, in such cases, you have to be careful. You need to give Ghrita Prayoga or Chira Prayoga based on your Yukti and Lekhyas, of course. So in mild cases, after second week, definitely. But in severe cases, wait up to 21 to 28 days. Because I am seeing that what happens is in severe cases, many of the cases shows Punar Avartaka Jwara Lakshana, where there is a reoccurrence of Jwara, especially when they were given early steroids and remdesivir was not active in that case. We see a surge of second phase. In such cases, you have to be careful. If NLR is not responding properly, NLR is still high on 28th day, still at 28th day, I don't give Ghrita Prayoga. So now again, you will tell I'm using NLR and other thing, but then it has come because we have been seeing so patient and we are seeing how is responding. But what I'm saying is from Ayurvedic perspective, if there is severe cases with still Ama Lakshana and Punaravartaka Lakshana and specially treated with steroid in early phase, means before 7 days of the symptom, like, steroid should be generally avoided on first 7 days of the symptoms. Unless until there was a hypoxia. But still, these days, everybody gives, the moment you say I'm COVID positive, remdesivir or favipiravir, all those antiviral, steroids, anti-allergic, Montelukast, everything is given. Now, in such cases, I've seen a lot of messed up case in home quarantine on concentrators. There, I am little careful up to 28 days.
Okay, sir. Sir, in diabetic patients, first 7 days and up to 14 days, what medications can be given?
I told you the protocol. So Bharangyadi, Panchatiktakam, Indukantam, Guduchyadi, all those things. Second phase, then I still continue Bharangyadi because see, Bharangyadi Kashayam, if you see the Phalasruti is good for Amajwaram, Jirnajwaram, Punaravartaka Jwaram, Vishamajwaram. That's a very good thing about Bharangyadi. So it's a broad spectrum. So Bharangyadi, then I add Guduchyadi, Drakshadi Kashayam, Nayopayam Kashayam, which is a little more Deepana Pachana and at the same time Brahmana. It's not too much of Brahmana like Ghrita, but yes, first you go with Brahmana Kashayam And then slowly, once you are sure that you have a good Agni, normal Agni, then you can start Indukantam Ghritam, Vidaryadi Ghritam, Guglu Tiktakam Ghritam. See, Guglu Tiktakam people, there is a very nice, I was having I asked Ayush, I was discussing with one of our colleague, I forgot her name. She was using Guglu Tiktakam. See, almost Vata Rakta Guglu Tikam, if you see Palasruta Swatsakasam is there. Now, this is a very important concept where she utilized her yukti, that where there is a fibrotic changes, where Vata Rakta, the Shrotas become Ruksha Shitam. Fibrosis is what? Ruksha Shutam. Anushna Snigdha will only work, and Gugulu Tiktikam is the Ghritam there. So, see, such a nice thought process from such Vaidyas. I really feel so good. I think Muttunagai, her name is, I don't know, I forgot her just name. So very, very good applications are there. And of course, there is Dhanvantara Ghritam. See, especially in our COVID diabetic research, see, Dhanvantara Ghritam is Sarva Pramehara, but we forget that what are the other indication of Ghrita, of Dhanvantaram. Hridrogam has been told, Vataraktam has been told, Gulmam has been told. Even, alcoholism. See, alcoholism leads to Prameha. We know now. But in Dhanvantara Ghritam, Phalasruti already has been told. So if alcoholic becoming Pramehi, what you have to give in a state where he is Ruksha Shita or not Ruksha Shita, Ushna Ruksha, you need to give Ghrita Prayoga. So you need to choose your own yukti for that. So Ghrita, all theseGhritas we are using. And for our study, specifically, we have also used Baladi Ghritam, because from a perspective of Baladi Ghritam, if you see the combination Vata Paitika Brahmana, but not creating Ama. So there are a lot of Tikta Rasa, Madhura Rasa, Aushadha with little Katu Rasa, but at the same time Krimihara. Nimba is there also a little there. Karanjirikam, Krishnajirikam is there. This all are very unique combination. We were just brainstorming, and that's how we have also used this as. But yeah, we use also other Ghritas as I have told.
Okay, sir. Thank you, sir. Moving to the next question. Sir, even in second week, if someone is using dextromethasone or any steroids, can we give Ayurvedic treatment, as steroids is immune suppressant and Ayurveda medicines are immune modulators? So doesn't the treatment become nullified?
No, our evidence is contrary. It improves the immune response. Let steroid do its duty, but we can improve the immune response. I think I will be able to tell you with more confidence. I have already data, but with that data inside, I said, no, we can improve better. Even if they are on steroid, please give with confidence.
Okay, sir. Thank you, sir. Moving to the last question. Sir, dosha prakopa in COVID is somehow opposite to the Ritucharya in Varsha and Grishma Ritu. Kindly give your insight about this.
Dosha prakopa, Vata Kafaja means.
Yes.
Yes,
Sir.
see, dosha prakopa, see, what is that chaya prakopa prashamana vayu grishma dishu trishu. Okay, so if you look at that Ashtanga Hridaya sloka, Vata gets chaya in, isn't it? Chaya in the Grishma Ritu and prakopa in Varsha Ritu. And you have a heen bala. So if you get a prakopa, like of COVID, which is Vata Kafaja also, and even if it is Sannipatika, the thumb rule is Kapha has to be treated first. Even if it is Sannipatika Jwara, Charaka, Vagbhata, every Kapha should be a Pradhan dosha first to be treated. Now, you see there is a Vata Kafaja Samsarga, and one Ritu it is Chaya of Vata and another Ritu is Prakopa of Vata. So in fact, Ritu is supporting this change. So I don't see how it is opposite. You may feel that, okay, Kapha is opposite to Vata, but then this is the biggest problem. See, most of the Asadhya Vyadhi, this trauma happens. or this dilemma happens. Like prameha and sthaulya, why it is asadhya? Because it is opposite. There is opposite dosha together. So you have some tarpana jana vyadhi, but you have to do aptarpana. Now, when you do aptarpana, then you ultimately increase a dosha which will create the vyadhi to become more degenerative or vatika. So this is where I think COVID is why it's difficult a little than other normal viral fever, because the nature of dosa dusha is makes it little difficult to handle. But if you are, that's why Guduchi Prayoga has become so popular. Even Ashwagandha people are talking. Why? Because see, Ashwagandha is Tikta Rasa, but Madhura Vipaka. See, in the Koshta, it does Amapachana, but when it goes in Sakha, it does Vataharatva Brahmana. Okay. Now, this is why Vichitra Pratyarabdha Dravyas will be more used in such kind of complicated fever. It's not like normal influenza. It's little more than, and this happens. You have a Vata Kapha predominant Sannipata in the lungs, which is a Rakta Dhatu. So, see, you can't think of easy things. So, why I'm trying to bring this in the Ritucharya perspective is because even when you are doing Ritucharya, so naturally, if you do Varsha Ritucharya, follow Varsha Ritucharya or Grishma Ritucharya, you will undo the extra Vata first only. Okay. Now you will say, okay, Varsha Ritu, what are the taste told? Like, Rasa told, like Amla. Can we give Amla in, Jwara Avastha? But there Amla is told in terms of Ahara. Okay. Even Amla is a very good example of preventive medicine for COVID is Amalaki, which is all Pancha Rasa Pradhana, where Amla Rasa is there. So preventive, when you see, so in prevention, preventive Ahara Vihara of Ritucharya will obviously help to reduce the samprapti or consolidation of the samprapti of Jara due to COVID. So if you are already following.
Okay, sir. Thank you, sir. So there's one last question. As Rasayana, please suggest the dose of Grita which can be given.
Yes, so it should be Agni Apekshaya. So what we are doing is we are going from 5 grams up to 12 grams, 5 to 12 grams dosage we are giving twice daily also, twice daily. That means 10 grams a day or 24 grams a day also sometimes.
Okay, sir. Thank you, sir. So that we come to an end of the discussion session. Okay, sir. So we'll move to the next program.
Thank you, sir. It was a really informative session. With that, we come to end of today's session. To render the vote of thanks, let me invite Dr. Tulya Mohan Das, Vice Principal, Ayurveda College, Coimbatore. Over to you, ma'am.
Gratitude is the healthiest of all human emotions. The more you express gratitude for what you have, the more likely you will have even more to express gratitude for. It's my privilege to deliver the vote of thanks to this vibrant gathering. On behalf of Ayurveda College Coimbatore and Team Diksha, on my own behalf, I express my humble gratitude to our beloved trustee, Dr. Senthil Ganesh sir. Thank you, sir. And our Health Secretary of RVS Health Science Campus, Dr. Nagrani ma'am. Thank you, ma'am. And our honorable dignitaries, Vaidya T.G. Vinod Kumar sir. Thank you, sir. Dr. Geeta Krishnan sir. Thank you, sir. Dr. Somit sir. Thank you, sir, for investing their valuable time in spite of their busy schedule. I also extend my gratitude to our beloved principal, Dr. Chandra Mollishwaran sir, All my hearted thanks to Diksha e-learning, Chiknyasa Tamil Nadu. I ask Ayush and to all our co-sponsors for rendering their constant support to make this event come true. Last but not the least, thanks to all the participants who have gathered here to make this event a grand success. Thank you, one and all.
Thank you, ma'am. Every sunset brings the promise of a new dawn. With the setting sun, we are coming to the end of a great day, the inaugural session of Ayur Samiksha 2021. Quoting Gautama Buddha, thousands of candles be lit by a single candle, and the life of a candle will not be shortened. Happiness never decreases by being shared. Likewise, the candle of knowledge lighted today, let it spread like a wildfire. Thank you all the dignitaries for joining us today. Once again, thank you participants and wishing to seeing you all in the next session of Samiksha 2021 on 18th June at 5 p.m. Thank you all. Have a pleasant evening ahead.